السلام عليكم.
وعليكم السلام.
وعليكم السلام ورحمة الله وبركاته.
How are you guys?
Alhamdulillah.
Alhamdulillah, Dr. Hani, how are you?
Yeah, fine. Okay, inshallah, today we will continue for history taking practice. We finished Socrates, and yesterday we started Odibara approach. Please, all people join the concise channel, because I found not all people join. Maybe still like 20% did not join, because I will post all PDF concise and updated in the concise channel. Okay, it will help you to save time in the exam channel. Okay, we have today for practice Dr. Ahmed Al-Amin, Dr. Feo Saint, I don't know what is the name, Dr. Sameh Feo. Okay,
Sure, yeah.
welcome. Dr. Sameh Bashir, Dr. Gul, Dr. Raji, Dr. Nasser, Dr. Jia, Dr. Ikra Khalid, Dr. Omar, Dr. Amjad, Dr. Aziz. If anyone want to practice, you can raise your hand and you can practice. Okay, so as usual, just 1 minute, how to get 10 out of 10, avoid jargon, give information and chance, check understanding, and also follow the general approach. Your attitude, very, very important to get 10 out of 10. It's not about approach. I will give you the approach, but approach only, it's not enough to get 10 out of 10, okay? The difference between you and the other candidate, your attitude. Again, some people, they memorize the approach very well and they get only 2 marks out of 10, okay? So your attitude, very, very important. Remember that, no need to waste the time. I mentioned in introduction, you can go for introduction. And follow the general approach. If you memorize the general approach for all history taking, it will help you to be ready for any new station in history taking. And remember, you will use Socrates or Odibara or who approach. After that, review of systems. So you have 8 systems, each 2 systems associated together. If you will start by GIT, it will be with urogenital and so on, okay? So start by the most relevant to the complaint. And the number 3, number 4, fix in all history station, dermatology, miscellaneous, whatever the complaint will be dermatology and miscellaneous, constitutional symptoms. Number 5, 6, 7, 8, it will be the least relevant. Past medical, past surgery, only 1 question, any past medical disease, any previous surgery, any prescribed medication, any allergy. And again, allergy should be allergy only. Don't say any allergy to medicine. Don't say any allergy to food, no. Any allergy. So allergy here, it's a general term for any allergy, okay? Any disease runs in your family, so only 1 question. Social history, only 3 questions. No need to mention more than 3 questions, okay? Sexual history, only if the patient has burning, micturition, or urethral discharge, whatever, male or female. Travel history, only if the patient has diarrhea or fever. Eyes, no need to ask about 3 questions of eyes. No need to say, what is your idea? What is your expectation? What is your concern? No need, okay? Just, would you like to add anything? What is your concern? Done. After that, I appreciate your concern. According to your data, the most likely problem, blah, 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 but we need to roll out, blah, blah, blah. Done. Okay, to save time. After that, the management, it depends on the station. Check the patient needs observation, isolation, resuscitation, consultation, refer, or appointment. Examination, fix that in all stations. We will do examination, some blood test, some imaging. It depends on the station. If you feel the patient his complaint related to the heart, so you will examine the heart and do heart tracing. If you feel the patient has something related to the GIT, so camera scan. After that, understand, accept the plan, further question, and so on. So we mentioned the introduction. After that, open question. It's very, very important. Let the patient talk. Don't ask open question and then close the question. It's not accepted. Don't say, can you tell me more about that? Is it suddenly or gradual? No, it's not open now. Okay. Open, it means, can you tell me more about blah, blah, blah? And let the patient talk. It means you are listening to him. After that, as we said, the present complaint, whatever Socrates or Utibara or who approach. After that, the general approach as usual. Today we will talk about sexual history. So 6 B's. Guys, can you hear me clearly?
Yes.
Yes, Dr. Hassan.
Yes, hearing.
Okay. Sexual history, if you
There is
memorize,
some connection problem, Dr. Hassan, from your side, or
I think from your side.
okay.
Okay.
Very
Yeah. So sexual history, it's very, very important. You have to memorize this slide. Only one slide, it will help you. Once you find in the exam, you will get 10 out of 10. Okay. In my exam again, I ask only about sexual history. I forgot to ask the patient about the general approach. I forgot to ask about past medical history, surgical, drug, family, social, and I got 6 out of 10. Can you imagine? I asked him only about sexual history only, okay? But I asked him in details, sexual history in details. In this station, I forgot at all to ask him about past medical, surgical, and okay. So 6 B's, we are talking about people, pregnancy, protection, practice, past, problem. So people here, I want to ask you a routine question. I'm asking all patients, are you currently sexually active? Yes. I removed with who, no need to say with who, okay? I updated this one. I said any other partner, because in the UK, they have regular partner, whatever married or not married, regular partner, okay? So just ask any other partner, done. If he said yes, ask how many partners. If he said no, no need to say, okay? So remember that, any other partner. So if yes, how many partners over the past year? And ask men, women, or both. Also ask about if men, are you receiving or giving sex? How much do you know about your partner? Have you or any of your sexual contact exchange money for sex? Any of your partner from different country? Any of your partner bisexual man? Any of your partners known to be HIV positive? Any of your partners injecting illicit drugs? Okay. And the pregnancy here, it depends, male or female, the actor, the patient, male or female. If male, you can say, are you trying to get your partner pregnant? It means he will not use any barrier. And if female, you will say, are you trying to get pregnant? Okay. And also, when was the last menstrual period? Protection, was it protected? Okay. And the practice, when was the last sexual act? Do you have vaginal, anal, or oral sex? Was this sexual encounter consensual? Were you by any chance under effect of alcohol or any illicit drugs? And ask about the past. Have you or your partner tested or diagnosed for HIV or sexual transmitted disease? Problems, would you like to add anything regarding your sexual health? And so on. So how to memorize that? Right. After the session, write that. If you write this slide 1 time, 2 times, 3 times, it will be like gum in your mouth. Travel history, also it's 1 slide, you have to memorize. Sexual history, travel history, very, very important in 90% of exams, but not 100%. It's not mandatory to come in the exam, but 90% it comes in the exam. Have you traveled anywhere recently in last 6 months? Yes. So ask about location, about time, about high risk activity, about immunization. Location, it means where did you travel? Where did you stay during the travel? Rural or urban? Type of accommodation? Whatever, hostel or hotel? Which places did you visit? Other travelers affected? And the time. When did you travel? When did you return? High risk activity. Did you have any procedure or receive any blood transfusion or any medical advice or help during the travel? Did you have recent contact with someone who is sick? If the complaint is fever, so you can say, did you have recent contact with someone who have fever? If the complaint is diarrhea, did you have recent contact with someone who is sick with same problem? At least you can say with same problem, whatever, fever or diarrhea. Did you drink or swim in contaminated water? Did you notice any insect or animal bites? Did you use mosquito net? Did you eat seafood, raw food, homemade food? So at least you can say, did you eat in your home or outside your home? Done. Immunization. Did you have immunization or chemoprophylaxis before travel? So again, you have to write in notes, okay? 1 time, 2 times, 3 times, it will be easy for you to memorize. And continue as usual. So Station of Socrates we finished. Odebara, first part we finished. Today we will talk about special stations, travel, sexual, amenorrhea. So amenorrhea from the start. This one you can ask, she will say, I have no menstruation. Don't say, I'm sorry to hear that. What is the problem if you stop menstruation? Okay, so you can ask here, can you tell me more about that? If you feel she is sad, so here you have to check, maybe she is happy and she want to check pregnancy. Okay, so why you will say I'm sorry? Okay, so here no need to say sorry until you feel she's worried about something. Okay, and ask her one question in the start. When was the first ministerial period? If she said, I have no ministerial period at all, so it's a primary. If she said, I was 16 or 15, so it's a secondary now, okay? So primary, she doesn't have menstruation at all. Secondary, it means she has menstruation at 14, 15, 16, or whatever, and now she has no menstruation, for example, 4 months or 5 months. Bleeding stations, the most important, you ask about questions of bleeding, where guys?
Intensity.
Intensity. Okay, so Odibara, you will ask about questions of bleeding. Questions of bleeding means how often, is it before, during, or after, what is the color, any clots, how many pads, how much, teaspoon or cup, any bleeding from other orifice. So not all questions will be suitable for the complaint, but if you feel it's applicable, you can ask. Okay. Okay. So what are the causes of bleeding, guys?
Maybe blood problem.
Blood disease,
problem.
excellent. Blood disease,
Maybe
excellent.
trauma.
What else?
Medications.
Liver
Blood
disease.
thinner.
Liver disease, excellent. What else?
Blood thinning medications.
Blood thinning medication, excellent. Whatever, antiplatelet or anticoagulant, excellent. What else?
Traumatic.
Ulcer.
Hemophilia.
Mechanical.
It can be trauma, excellent. What else?
Malignancy.
Okay. Okay. So the most important, blood disease. Number 2, blood thinning medication. Number 3, trauma. Remember that. Okay. And also maybe because of ulcer, if the issue is upper or lower GI bleed. Okay. So Dr. Ahmed Al-Amin. And of course, who approach if event. And here at children, it will be a different approach. You will add prenatal, natal, postnatal, if pediatric, and developmental after that immunization. Here, explain new diagnosis. You reverse the approach of history taking. So you can explain the disease, explain the crisis, ICE, explain the short-term management, long-term management, and then brief history, but without present to complaint. Don't waste time in present to complaint. Okay, Dr. Ahmed Al-Amin. Dr. Ahmed? Okay, so we will go for the next one. Dr. Feo?
Hello.
Yes?
Hello. Can you hear me?
Yeah.
Okay.
Okay, so you have 30 seconds to prepare yourself. After that, 6 minutes.
Okay.
You can start.
Okay. Hello, my name is Dr. Pyo, ED Register. May I know your name and age, please?
Khaled, 23 years.
Hello, Mr. Khalid, nice to meet you. I've been asked to take some data from you. Would that be okay?
Yeah,
Do you want someone to attend with us?
no need.
Would you mind if a nurse attend with us as a chaperone?
Okay.
How can I help you?
Yeah, I have high temperature, doctor. I checked today. It's high.
Did you take any medication for that? Are you comfortable now?
Yeah, I'm okay. I took paracetamol today.
Oh, it's great. Well, Mr. Khalid, I'd like to move you to the isolation room and check your vital signs. Would that be okay?
Okay.
Could you tell me more about your fever?
Yeah, this one started for 1 month, and it's same. Okay, and if I am
Mhm.
taking paracetamol after 4 hours,
Okay.
it come back. I'm really worried about that.
Oh, I'm sorry to hear about that, Mr. Khalid. So it's been about a month and it's not increasing or improving. Is it the same, right?
Yeah,
So is it started suddenly or gradually?
suddenly.
Does it affect your daily living activities?
No, but you know, a fever for 1 month. I think it's a serious.
Oh, yeah, I can understand that. Well, can you score your fever from the score of 0 to 10, 10 being the worst?
I think a 7.
Okay, so you said that the fever downs after 4 hours. It means your fever is on and off.
Yeah,
Okay, did you notice anything makes it better
only
apart
paracetamol.
from paracetamol? Okay, and what makes it worse?
No idea.
Okay, is the fever associated with coughing or wheeze?
No,
Any shortness of breath or difficulty in breathing?
no.
Any nausea or vomiting?
I'm feeling sick, yeah, sometimes.
Okay, but you don't throw up, right?
No.
Okay, any tummy pain or yellowish coloration of skin or eye?
Yeah, I noticed the yellow discoloration. It's like 2 weeks now.
Okay, is it worsening now?
Yeah, yeah.
Okay, is there any tummy pain?
No.
Okay, did you have any changes in bowel movement or urination?
But I noticed the change in the color in the urine also.
Okay, what is the color?
Dark.
Sorry,
Dark.
dark? Oh, okay. And you reduce urine output or painful urination? No?
Yes.
Any painful urination or
No,
reduced
no,
urine output?
no,
Okay, okay. Any skin changes or skin rashes?
no,
Any night sweats or lumps or bumps in the body?
no.
Okay. Any changes in body weight or any appetite?
Yeah, I lost my appetite.
Okay. Any headache or jerky movements?
No,
Neck rigidity or back rigidity?
no,
Okay. Any weakness, paralysis in the body or limbs?
no,
Okay. Any medical diseases, past
no,
or current?
no,
Any hospitalization before?
no,
Any surgery done before?
no,
Are you taking any regular medications apart from paracetamol?
no,
Are you any allergies? Who do you live with and where do you live?
was my wife in downtown.
Do you drink or smoke?
No,
Are you using any illicit drugs?
no, no.
What do you do for a living?
I'm studying.
Okay. Did you travel anywhere recently
No, no.
in the last 6 months?
Yeah, yeah,
In the
yeah,
last 6
yeah.
months.
I remember. Yeah, yeah. I traveled to Malaysia. It was like 40 days ago.
40 days ago. Okay.
Yeah,
Where did you live? Urban or rural area?
I think rural area.
Okay. What type of accommodation did you live?
It was hostel. I was with my friends.
Okay. Did your friends okay? Are they sick or not?
The same problem.
Okay. When did you travel and when did you arrive back?
Yeah, I told you 40 days, and I came back.
Yeah, 40.
Yeah, I came back like 1 week ago.
Okay. Did you seek any medical advice or receive blood transfusion or any
Yeah,
procedure done there?
they gave me paracetamol.
Okay. Did you drink or swim in the contaminated water?
Thank you. Okay.
Okay.
So, well done, Dr. Few. So,
Thank
you are
you.
doing well, but you are not controlling your time. Okay.
Yeah.
So,
Okay.
first of all, you did not show your empathy in the start. Okay. You did
Yeah.
not say, "I'm sorry to hear that." Even fever for the patient, he came to the hospital. It means he's worried, right?
Yeah.
Okay. So you have to say, "I'm sorry to hear that. I need to move you to isolation room because according to pandemic now, any patient with fever should be in isolation room, right? In respiratory
Yeah.
triage, at least. So give me seconds. You can tell him like that. Give me seconds. I will wash my hands and wear PPE. Or from the start,
Okay.
especially in this station, I will wash my hands and wear PPE. If you remember after you talk to the patient, okay, so give me seconds to wash my hands and wear PPE. Okay.
Okay. Yeah.
After that, you can ask him. You did very well, but ask the most relevant questions. Accelerate your tone. Okay. So I will give you 10 seconds management plan.
Management plans. Okay, Mr. Khalid, according to the data I collected from you, your fever might be due to your travel. But to confirm your diagnosis, I need to keep you in the isolation room, check your vital signs, and do thorough physical examination, including your head, chest, anatomy also, and do some tests, including chest X-ray and heart tracing, and including blood tests that will involve hematology, inflammatory markers, biochemistry, blood culture, and urine culture also. If after I got the detailed examination and
What is the problem,
investigation
doctor?
results,
What is the problem?
I think it might be some sort of bloodborne diseases like malaria, because you travel to Malaysia and you live
Excellent.
in the
Thank
rural
you.
area.
Excellent. Thank you. Okay. So I want you to be clear with him. Okay. What is your concern? Blah, 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 blah. I appreciate your concern. According to your data, the most likely problem you have high temperature. Maybe it's related to your travel. I don't care about the specific diagnosis now. Show the examiner this one related to the travel. Okay. You have for example, travel to Malaysia, and also you have yellow discoloration, you have dark urine, or blah, 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 blah. Give him a brief summary. So most likely problem will be malaria. We need to rule out other infections. Okay. So we need to do examination for you in isolation room, keep you in isolation room, do some examination, some tests, including infection screen. What is infection screen, guys?
Blood culture.
Septic screen. Septic screen. But you will say infection screen. Okay. Like chest X-ray, blood culture, also stool culture. And after that, you will do also sick and the cell film for malaria. Okay. This patient needs admission, guys, or no need?
I think admission, because yellow coloration and high fever for a month.
Most likely.
It depends.
If he's having
Depends on the
simple
lab.
malaria, he will be admitted. If it is not complicated malaria, simple malaria,
Yes.
he can be treated out home.
You mean outpatient?
Yes, outpatient treatment.
So you will examine the patient and you will do a blood test. If confirmed malaria, you will consult infectious disease specialist. Okay, and he will take medicine for malaria. Okay, this is the most important. But if they show you any lab result and you feel something serious in the station, so you can admit the patient for IV artist unit. Okay, well done, doctor.
Dr. Hani,
Yeah.
هنا we need to notify notification.
What do you think, guys? Notification.
Yes,
Yes, yes.
yes.
This is notifiable disease.
Notifiable
Malaria is
disease.
a part of a notifiable disease.
Yes. What about HIV? Notifiable?
No.
No.
It isn't. It is
No.
notifiable.
Before it was. Now it's not anymore. Okay. Next
Are
one,
they
Dr.
going
Sam.
to ask about it in the exam?
Again, please.
Are they going to ask if it is notifiable or no in the OSCE?
No, they will not ask you directly, but you have to notify. And any notifiable disease, it's breaking confidentiality, right?
Yes.
And breaking confidentiality, you have to take consent from the patient, right?
Yes.
Mhm.
Yeah.
So you have to inform him in front of the examiner. I want to ask you about this malaria. If confirmed, until now you are not sure. If confirmed, we have to notify, blah, blah, blah. Okay? Even if he refuse, you have to notify also, but at least you have to take consent first from him. Okay. Dr. Sameh?
Yes, Dr. Hani.
Yeah. So you have 30 seconds. You can start.
Okay, I knocked the door, washed my hand, wearing my PPE. Hello, I'm Dr. Samih. I'm an emergency physician. I was asked to take some data from you. May I confirm your name and your age, please?
Yeah, Karim, 43 years.
Nice to meet you, Mr. Karim. Mr. Karim, how I can help you today?
Yeah, I have lost bowel motion, doctor.
Oh, I'm sorry to hear that, Mr. Karim. Can you tell me more about this loose motion?
Yeah, it's like 1 week. It's recurrent and worsening. Each time I pass a stool, I have diarrhea. And this happened, you know, I just arrived from Mexico. I was in United States, and I was admitted there for chest infection, you know. They gave me treatment there. I was admitted for 2 weeks there.
Okay, thank you, Mr. Karim, for this information. As you mentioned, it is starting a few days ago. May I know if you have this same episode before?
No, no,
Anything make this loose motion better or make it less?
I don't know. I have no idea.
Okay, Mr. Karim. It is affecting your daily living activities.
It's not affecting, but I am really worried about that.
I appreciate what you are concerned about. This diarrhea, it is contain any blood, any things, or just it is simply watery diarrhea?
It's like watery diarrhea.
Water diarrhea. Is it associated with any other things? You noted that? Did you have any high temperature? Do you throw out?
Yeah, I have a high temperature.
And did you also accompany with throwing out or something like that?
No,
Since this diarrhea is starting, did you notice that you lost your appetite also?
yeah,
Did you lose weight also?
yeah, I checked my weight. I lost like 10 kilograms.
I'm sorry to hear that, Mr. Karim. Did this loose motion have also accompanied with abdominal pain, tummy pain, or any change in your skin or your eyes?
Yeah, I have tummy pain, but no yellow discoloration.
Okay, Mr. Karim. Then did there is any change in urine also?
No,
Any discharge with this normal, any urine discharge or
no,
something like that?
no, no.
Okay. You mentioned something regarding you was being admitted for some chest infection. Did you still have this chest infection or it's
No,
improved?
no, I was okay. I was okay. They discharged me and I was okay.
Okay. Currently, did you have any shortness of breathing or wheezing or cough?
No, no, no.
Did you have any chest pain or heart racing or dizziness?
No,
Any headache, any jerky movement, or any abnormal in vision?
no, no.
Nice. Mr. Karim, I would like to ask more question if you are not minding. What did you have any past medical history?
No, no. Only the chest infection before.
That the previous chest infection. Okay, good. Did you have any surgical history? That's all.
No, no.
Mr. Karim, did you take currently any prescribed medicine?
No,
Did you have allergy to any medicine?
no,
Any family history from any kind of disease?
no, no.
Mr. Karim, may I ask you where you are living now
In downtown,
and with whom?
my wife.
Okay, Mr. Karim. Are you currently sexually active, Mr. Karim?
No.
Okay. And I need to dig more for this traveling you tell me about. May I know you you are staying in Mexico for how many times?
It was for 1 month.
I mean, how many days? It's less for how for 1 day. Where you are staying in this 1 month?
I was in my relative home.
With their home. In this home, did anyone observe that he have the same symptom you have?
No, 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 no.
Okay, then did you have any other activities in this 1 month? Did you have or received
No, no,
blood?
no. I did not go anywhere.
Did you drink any contaminated water from
No, no,
contaminated
no,
source? Did you
no,
contact with
no,
any animals?
no, no, no.
Did you receive your post-traveling vaccination?
Yeah, I took vaccination and immunization before traveling. Yeah.
Very nice. Very
And
good.
and the Mexico, I think it's okay.
There is a bit
Okay.
local disease they have it there. We didn't have in our country, as you know. Okay, Mr. Karim, may I know what's your concern currently?
Yeah, I am worried, doctor. Each time I go bathroom, I have diarrhea.
Okay, Mr. Karim, I appreciate your concern. First of all, now I need to move you to isolation room.
Thank
and
you,
do
Dr. Sam.
okay. Okay.
Okay, thank you. I will give you 30 seconds to continue.
Okay. Okay. Then I need to carry out all physical examination through carry out the physical examination. Then I need to run some blood tests and some stool test also. I need to do some stool culture and blood culture to figure out what do you suffering from. And I believe that you are carrying some of infectious disease that you brought with you. And there is another possibility that because if you are admitted in the hospital in Mexico, you may have also one form of post admission infection, and we need to go through that to figure out what you are suffering. Is it clear with you? Is it good with you, Mr. Karim?
Okay, thank you, Dr. Sam.
Welcome.
Thank you. Okay, well done. Here you are following the general approach. What I need from you to accelerate your tone, number one. Also, here I change the station. What do you think? What is the problem here?
You have a diarrhea post admitted to the hospital.
So what
Could
is the
be,
diagnosis?
Antibiotic induced diarrhea.
Clostridium.
Clostridium difficile diarrhea.
Yes, yes.
Excellent. Clostridium difficile. Clostridium difficile. Yes, excellent. So
Yes.
here, if they mention, for example, Malaysia, Nepal,
Tropic
India.
country, I mean.
Sorry to say like that, guys, but this is the mind of the UK. Okay, so they will give you idea it's something related to malaria or but if they will mention US, it means it's not related to infection. Okay, it's related to something Clostridium difficile, something like that. Okay.
Dr. Hani, by the way, Hani, when you mean Mexico City, I believe you are speaking about the Mexican country, because that I'm going through this track. Sorry
Mexico
for
is a part of North America, so still
Yeah.
considered it.
No, if he is speaking about Mexico City itself, New Mexico, you mean? This is another. I think you are speaking about Mexico, the country.
Anyway, whatever.
Okay. I get that.
Yeah.
Yes.
Any thing rather than Malaysia, India, and. So think about Clostridium difficile. Okay.
Okay, Doctor. Okay, very nice.
Yeah. This is the point. So here, whatever, if he give you any clue, so it will be related to this clue. Be intelligent. So the most likely problem, you have diarrhea. If he said diarrhea, say diarrhea. If he said loose bowel motion, you can say loose bowel motion. Okay. So most likely to be related to your travel because you were admitted in the hospital after that this happened. So maybe because of the antibiotics they give you, which is causing Clostridium difficile infection. Okay, so what we are gonna do now, from the start you did not move the patient to isolation room, right?
Yes.
I cannot remember.
I did
Anyway,
not.
yeah, so it's a very, very important, diarrhea or fever or any infection. So the patient in isolation. Okay, so in the end, already the patient in isolation room. So I will keep you in isolation room, do examination, some blood tests, and infection screen, including a stool microscopic culture sensitivity, because he said, for example, 1 week or more than 1 week. So you can consider culture and sensitivity. If he has bleeding, so this patient, he will need admission. But if the patient has only watery diarrhea, so anyway, you have to be familiar with red flag. I put red flag in the PDF in the channel. Okay, so you can check the PDF. Anyway, this station, you have to ask about questions of travel history. I denied most of the questions, right, Dr. Sam?
Yes, it's correct.
Yeah, I am taking immunization. I did not go anywhere. I have no active practice. And also I am living with my relative in his home. It means everything will be clean, right?
Yes.
Yeah, so I denied infection. Okay, I denied source of infection, but maybe this because of antibiotic and the any patient admitted, so for sure it's a Clostridium difficile. Okay, well done, Dr. Sameh, but what I need from you, accelerate your tone.
Okay, doctor.
Yeah, and also regarding the approach, guys, I'm talking to all, not to Dr. Sam. According to sexual history and the travel history, it's very common in the exam. Just 2 slides, if you memorize them, it will give you confidence in the exam, inshallah. Okay, Dr. Gol.
Assalamu alaikum, Dr. Hani, yes?
Alaikum salam. Yeah, you have 30 seconds. You can start.
Good evening. My name is Dr. Gul, one of ED registrar. Can I know your name and date of birth, please?
Yeah, Kareem, 43.
I have been asked to take some data from you. Is that okay?
Okay.
Are you comfortable right now?
Yeah.
Do you have any pain?
I took painkiller, doctor.
Okay, so how can I help you today?
Yeah, I have burning micturition.
I'm really sorry to hear that. So could you please tell me more about that?
Yeah, this one started last night.
So how did it started? Suddenly or gradually?
Gradually.
So as you told me, it started last night. Am I right?
Yeah.
So could you please tell me, do you have any increased frequency of urination?
Yeah.
So any pain during urination?
Yeah, I have burning micturition.
Any discharge from your urethra?
No.
Any increased body temperature?
I did not check.
Throwing out?
No.
Okay, so could you please tell me, is it continue, same, or worsening?
It's worsening.
Any similar condition before?
No,
Anything make it worse?
I no idea.
Anything make it better?
No idea, doctor.
I need to ask you some private question if you don't mind. Is that okay?
Okay.
Are you sexually active?
Yeah.
With whom?
Actually, I have one female sex partner.
Okay, so any other sexual partner you have?
Yeah.
Are they male, female, or both?
Female sex partner.
Okay. So do you know anything about your partner?
Yeah, she's working with me.
So is it from same country or from different country?
Yeah, she's in the same country.
So do you know anything that your partner having HIV?
I don't know, but I don't think she have. I don't think.
Is your partner, any of your partner using any illicit drug by any chance?
Only one female sex partner, doctor.
Okay, so are you trying to get pregnant to your partner?
No.
So when did you did last time sex?
It was like 5 days ago.
So was it protected?
Yeah.
Was it anal, vaginal, or oral?
It was all.
Was it consensual?
Yeah.
So it was not. Was it under effect of alcohol, any illicit drug?
Under effect of alcohol. Yeah.
So have you or your partner ever diagnosed with HIV or any sexual transmitted disease? Hello?
I said no.
Okay, so I didn't hear, sorry.
Okay.
Okay, so could you please tell me you have any tummy pain?
No.
Okay, any weight loss?
No.
Change in your appetite?
No.
Change in color of your skin?
No.
Any lumps and bumps?
No.
Night sweats?
No.
Breathing difficulty?
No.
Racing of your heart?
No.
Any headache, change in your vision?
No.
Any weakness, paralysis?
No.
Any trauma?
No.
Any rash?
No.
Any past medical history?
No.
Any recent hospital admission?
No.
Any recent surgery?
No.
Are you on any prescribed medication?
No.
Any allergy? You're living with whom?
I'm living with my wife in downtown.
And what you're doing for your living?
I'm not working.
Do you drink alcohol?
No, no,
Do you smoke?
no,
Did you travel recently?
no.
So may I ask what is your concern?
I'm worried, is it HIV or any sexual transmitted infection, or what is the problem? I don't know.
So I appreciate your concern.
Thank you. Thank you. Okay. I will give you 20 seconds.
So I appreciate your concern, and that is my concern too. So thing is that like we need to I need to admit you in isolation room. And we'll do physical examination. We'll do general physical examination and examination of your tummy, your penis and testes, and your anal canal. And would like to run out some tests, and that include a urine test and virology screening that include HIV, hepatitis A and hepatitis B, and urethral swab and urine analysis to get know about the exact cause of your symptom, and then accordingly I will treat you. And if needed, then I will arrange a follow-up with gum clinic and with gum clinic and infectious disease. Is that okay with you?
So is it serious, doctor?
Actually, I need to investigate it out before. I need to do your virology.
You're asking me questions, doctor, right?
What data I took it from you? Is it no? You have risk but low risk
So
for
this
getting
one.
this.
Okay, thank you, Dr. Good, thank you. Okay, well done, well done. You have organized the approach, but you are asking the questions like asking checklist. Okay, I did not feel that you are asking or taking data. Did you get my point?
I get confused. I get confused.
Okay, so you are asking me like that. Heart racing, shortness of breath. No, I don't want like that. Okay, I want to feel that you are asking me questions to get data, not just a checklist. Okay.
Yeah.
Okay. So with time it will be easy for you. Anyway, ask the most relevant question, especially in sexual history. Okay.
Okay.
So I will do this station. Good morning. I am Dr. Hani, PD consultant. I am the most senior here. May I know your name and age, please? Karim, 43. Nice to meet you. Anyone attend with you? Would you mind if nurse attend with us as a chaperone? Are you comfortable now? Do you have any pain? How can I help you? I have burning micturition. I'm sorry to hear that. I need to ask you some questions related to sexual history. And these questions, we will be in private room and one nurse attend with us, and anything you will tell me will be confidential. You can stop me at any time. Is that okay with you? Yeah. So can you tell me more about your burning micturition? This happened last night, gradual, increasing. Okay, so as you said, this happened last night, increasing and worsening. Do you think anything increase it or relieve it? No idea. So here you have to ask about the sexual history. Okay, but before sexual history, you have to ask about only associated symptom genitourinary here, more than enough. don't go, after you finish Odebara, don't go for all review of systems. Don't waste the time. Okay, Dr. Gol?
Yeah, doctor, I'm getting you.
Yeah, so I will continue. Genitourinary. Do you have urethral discharge? No. Any skinny change in genital area? No. Okay. Do you have how I will ask about other symptoms in one question? Do you have other symptoms apart from the one you mentioned? No. Done. Clear, Dr. Gol?
Yeah, clear.
This is how I concise the approach. I don't want to go deep in review of system because sexual history, it's a long station. If I will ask everything, I will not reach a differential diagnosis. So after I finish genitourinary, do you have other symptoms apart from the one you mentioned? No. Okay. Are you currently sexually active? Yes. Do you have other partner? Yes. So male, female, or both? Or how many partner? Only female sex partner. So no need to ask male, female, or female. If you said female sex partner, I told you female sex partner. You ask me 2 questions. It means you are not listening to me, and this is against you. Clear, Dr. Gol?
Yep, clear.
Yeah. So if you ask something against the answer previously, it means you are not listening, and this is against you. Okay. So you can continue as you mentioned the sexual history, and here after you finish that, do you have past medical disease, any previous surgery, any prescribed medication, any allergy, any disease running in your family, and also you can continue to that. So the management plan, you have to be clear, guys, with the patient. This, you are taking data from the patient. Why? Any idea, guys? Why we are taking data for sexual history? Why?
Give him proper
To
treatment.
trace the other partner also.
Again?
If
Excellent.
30 days.
Excellent.
To give him
Hi-
post.
High risk or low risk? We are taking data to tell the patient you are at high risk or low risk. Why the patient came? To understand it's a low risk or high risk. Okay? He's worried. Okay? So after you give the information, what would you like to add anything else? What is your concern? I appreciate your concern. If you feel it's a low risk, this is good communication skills. What you will say? I have good news for you. According to your data, it's a very low risk to get infection, HIV or other sexual transmitted. If you feel from the station, it's a high risk, I appreciate your concern, but I have bad news to you. According to your data, you have high risk to get infection, like HIV or other sexual transmitted infection. Clear, guys?
Yes.
Okay, so this is communication skills. They will give you marks for your communication skills. It means you are clear with the patient, low or high. If low, how we will talk with the patient. If high, how we will talk with the patient. It's not about information, guys. If they are testing your information or your knowledge, they will test you in written exam, okay? But they want to test skills, how to communicate with patients if you will work in the UK. Okay, so here, if low risk, you will give post-exposure prophylaxis.
No.
If high risk, you will give
Yes.
within
3 days, 72 hours.
72 hours. Excellent. So you will not give post-exposure prophylaxis if low risk or high risk, but more than
72 hours.
72 hours.
clear now. So prepare yourself for that. Sometimes they will give you a station for low risk, some station with high risk. So remember that. Anyway, if you will give post-exposure prophylaxis, tell him for how long post-exposure prophylaxis?
4 weeks.
4 weeks.
28
Excellent.
days.
4 weeks. If high risk, you will do virology. If virology, it will be if negative within 4 weeks, it's exclusive.
No, after 4 weeks, we have to repeat the test.
You will repeat after how long?
1 month.
Yes, I said after 4 weeks. It means after 1 month. If virology for HIV negative, you can say to the patient you are negative.
No.
You will repeat at 3 months and 6
3 months,
also.
3 months time.
Okay, so you will repeat after 12 weeks or 3 months, right? Excellent, guys. Okay, so to confirm it's a negative, it should be after 4 weeks and then after 12 weeks or 3 months. Okay, so I think now it's clear. Number 2, if he said, if you ask the patient, are you trying to get your partner pregnant? It means the regular partner. Here, if you say partner, you mean regular partner, whatever his wife or not, okay? If he said yes, so you have to notify the partner, and you have to ask him to follow up with JB or with GAM clinic. And you have to give advice, avoid blood transfusion until results come, okay? Results here, it means until he is negative 2 times. And also regarding sexual history, sexual intercourse, you have to avoid sexual intercourse or at least wear a barrier. Clear, guys? Okay. Next one. Yeah.
If he don't want to inform his wife, so we should insist on that he should inform, or we shouldn't insist.
In the exam, he will not refuse, but in case he will refuse, so you can, if you still have time, so can you tell me why you don't want to inform here? Explore anything abnormal in the OSCE exam. Explore. Okay? For example, I want to give you antibiotic. He said, no, I don't want antibiotic. Can you tell me why you don't want antibiotic? Clear? If check why he doesn't want to tell her. Okay? Maybe he's ashamed to tell her. So you can encourage. Okay? So you can say, I think you agree with me. This is high risk and high risk for her as well. So I think you agree with me. If you love her, you have to notify her. So he will accept. Okay. And again, they will not waste your time. They know that you have limited time in this station. Okay, guys, we wasted time here in this station. So the next one, Dr. Raji.
Yes, sir.
Okay.
Good evening.
Next station. Welcome. You have 30 seconds.
Okay.
You can start.
I need to wash my hands and wear my wear my personal protective equipment. Hello, I'm Dr. Rajalakshmi, ED registrar. Can I confirm your name and age, please?
Yeah, Nadia, 33.
Nice to meet you, Mrs. Nadia. I have been asked to take some personal data from you. Would that be okay with you?
Yeah.
Okay. And this conversation would take place in a private room. And one of the nurse, she will be attend with us. Would that be okay with you?
Okay.
And tell me, Nadia, how can I help you today?
Yeah, I have burning micturition, doctor.
I'm sorry about that. And also I want to inform you that anything you tell me today will be confidential between us.
Thank you.
Thank you. Do you want attend? Do you want anyone to attend with you?
No, no.
Thank you. Can you tell me more about your symptom?
Yeah, this one started 2 days ago, and it's increasing, worsening, and also I felt each time I go to pass urine, it's painful.
Okay. Oh, it started 2 days ago, and it worsening and increasing. Is it right?
Yeah.
Can you tell me, do you have any other symptoms other than burning micturition, like any urethral discharge or a vaginal discharge?
Yeah, I have this charge as well.
Okay. How long do you have this vaginal discharge?
Same.
Same, 2 days. Okay. Can you tell me what amount of discharge do you get, and how often do you get it?
Yeah, each time I pass, I found that.
Did you notice any smell or any color change?
Yeah.
Can you tell me what color it is? And
Yeah, it's like green, and it's a full smell also.
okay, I'm sorry about that. Okay. And does anything makes it worse? Your burning micturition?
No idea, doctor.
Does anything makes it better?
No idea.
Okay. Do you have any other symptom other than you told these symptoms, like any difficulty in urination?
Yeah, I told you I have burning micturition, doctor.
It reduced urination.
No.
Okay. Do you have any tummy pain?
No.
Okay. Did you notice any yellowish discoloration of your skin?
I have like skin changes in genital area, and I found some ulcers.
Okay. When did you start notice that?
Yeah, yesterday.
Yesterday. Okay. Does it have any itchiness over the area?
Yeah.
Okay. Okay. Do you have any? Did you have any high temperature? Any night sweats?
I did not check.
Okay, it's okay. I want to ask you some personal questions. Can I go with that regarding
Okay.
your sexual history? And are you currently sexually active?
Yeah.
Who's your sexual partner?
Yeah, I have a male sex partner.
Okay.
One.
Okay. One partner. Is it right?
Yeah.
Okay. Do you have any other partners recent for past 3 years?
Yeah,
Other-
I have two. It was like 48 hours ago.
Okay.
Yeah.
48 hours ago. Okay.
Yeah.
Do you know about anything about him?
One of them same country, and the other one other country.
Okay. Where is he from? Which country?
I don't know.
Okay. And I'm sorry for the question. Was there any exchange of money for your sexual act?
Yeah.
Okay. Was it protected?
It was protected, but the barrier was torn.
Okay. Was there any penetration?
Yeah.
Anal or oral or vaginal?
vagina.
Okay. Um, have you ever diagnosed with the history of a sexually transmitted disease?
No.
Okay. What about your partner?
I don't know.
Okay. Were you under the influence of alcohol or any illicit drugs during your
Yes.
sexual intercourse?
Yeah.
Okay. Are you trying to get pregnant?
No.
Okay. Is there anything else would you like to add? Tell me regarding
No.
your sexual practice. Okay.
No.
Thank you. Do you have any past medical problems?
No.
Any previous surgeries?
No.
Any disease run in your family?
No.
Are you on any prescribed medication?
Thank you.
Thank you, sir.
What do you think, Dr. Raj?
I didn't finish within my time.
Okay. Okay. So you are doing well, but just focus on the most relevant questions. Okay.
Okay, sir. Okay,
Yeah.
sir.
And accelerate your tone also.
Okay,
Okay.
sir.
Yeah. So here, genitourinary, the most important is genitourinary. So here, burning micturition. I'm sorry to hear that. I want to ask you some questions related to your sexual history, and we will be in private room. One nurse attend with us as a chaperone, and anything you will tell me will be confidential. And you can stop me at any time. Is that okay with you? Yeah. Okay. Can you tell me more about your burning micturition? Blah 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 blah. You have urethral discharge? Yeah. So is it green or yellow? Is it smelly or not? Done. No need to ask more details. No need to waste the time. Do you have any skin changes or ulcers in genital area? Done. Do you have any other symptoms apart from the one you mentioned? Done. Are you currently sexually active? Blah, 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 blah. And you can go directly and quickly with all. Clear?
Okay, sir.
Okay. This one, high risk or low risk?
High risk, sir.
What you will do?
I'll start the post exposure prophylaxis because
Ask me. I will give you 30 seconds. Ask
Okay,
me about my concern and continue.
Okay, sir. Can you tell me what is your concern, Mrs. Nadia?
Yeah, I am worried. Is it HIV or any other sexually transmitted infection?
I can understand your concern. I appreciate it. We are also more concerned about it. From the history you have given, the history given, from the history, it is most related to high risk, which relate high risk to sexually transmitted disease, which is HIV also. So we want to start you on post-exposure prophylaxis. Do you have any idea about that?
Yeah, I read about that.
Yeah, it should be started within 72 hours of last sexual act. So we're going to start that now. Before that, I want you to check, stay in an observation room, check your vitals, do some physical examination, including tummy and genital examination as well. Do a high vaginal swab, and do some blood investigation also. And also we're going to start you post-exposure prophylaxis. And also I strongly advise you to notify your sexual partner and avoid blood transfusion, and use barrier contraceptives if you have sexual intercourse. Would it be okay with you?
Okay, thank you, Dr. Raj. Thank you.
Thank you,
Okay, I want you to phrase your questions, phrase your answers, phrase your differential diagnosis management, how to phrase them right by your hand. Okay.
Okay. Okay.
You have question 14 words. How to make 5 words. Okay. This is how to pass the exam, guys. You have to stay with yourself and write. Okay. So I will do the management plan. So would you like to add anything else? What is your concern? I appreciate your concern. According to your data, I'm sorry to tell you that you have high risk to get infection. whatever HIV or other sexual transmitted. Can you see how I am talking?
Yes, sir.
Yeah. Okay. So the good news that you came early within 72 hours. Okay. And what we are gonna do now, examination, no need for details. Some blood tests, including virology.
Okay.
Especially HIV and hepatitis C also, hepatitis B. Okay. So here we can give you post-exposure prophylaxis for HIV. Okay. It will be for 4 weeks. And we will give you medicine to prevent feeling sick or throw up. Okay. And we will, if the test of HIV negative after 4 weeks, so we will repeat that after 3 months. Okay. If you have positive tests, so we will give you treatment, active treatment for the virus. Clear, guys?
Yes, sir.
Okay. Thank you.
Yes, sir. Thank you.
Welcome. Dr. Gia? Yeah?
Yes, regarding this, we are just focusing with viral infection, but there is another possibility in this kind of scenario, like sexual transmissions like gonorrhea or something like that. Apart from one investigation, we also will inform the patient that we can start like that. Can you just?
So you are talking about other infection.
Yes, doctor.
Yes, we mentioned that. So if the patient with low risk, it means a low risk for HIV and the other sexual transmitted infection. If the patient is high risk or low risk, it will be for both, okay? You have to mention both. So if you will say HIV, you can mention also and the other sexual transmitted infection, okay? Okay. So if the patient has high risk, so you will give post-exposure prophylaxis and, for example, antibiotic azithromycin. This is your point.
Exactly, this is my point, doctor.
Yeah, so you have to cover HIV and the other sexual transmitted infection as well, okay? Yeah, so you will give antibiotic. If the patient is low risk, but he has discharge, what you will do, guys?
Injections, ceftriaxone.
Connection.
So antibiotic only, right?
Yes.
Yeah, no need for post-exposure prophylaxis, but you will give him antibiotic only for discharge.
And swab culture.
Yeah, and the swab, yeah. Okay. Excellent, guys. Dr. Gia?
Yes, doctor.
Yeah. Alaikum salam. You have 30 seconds. You can start.
I'm going to wash my hands, put on my PPE. Good morning. I'm Dr. GIED Registrar. May I know your name and age, please?
Karima, 43 years.
Nice to meet you, Mrs. Karima. I've been asked to collect some data from you. Will that be okay with you?
Yeah.
So are you suffering from any pain or any discomfort at the moment? I can offer you some medicines.
Yeah, I took painkiller, doctor.
So are you comfortable right now?
Yeah.
Okay. So do you have anyone waiting for you outside?
No.
So would it be okay if you're not just present with us as a chaperone?
It's okay.
Okay, so how can I help you today, Mrs. Karima?
Yeah, doctor, you know, my period stopped like 4 months now.
Okay, I see. So your concern is your periods have stopped 4 months back.
Yeah.
So it was regular before that?
Yeah, it was regular, yeah.
Do you remember the age when your periods have started?
I was 14.
14 years.
Yeah.
Okay. So do you have any other concern apart from the periods that have stopped, anything like that?
Yeah, you know, I have headache also and some visual disturbance.
Oh, I'm sorry to hear that. Since when has this headache and visual disturbance started?
Yeah, it started like 1 month.
Okay, so is it increasing or decreasing?
Yeah, worsening.
It's worsening. So you were saying about some visual disturbance. Can you please elaborate? Like what kind of visual disturbance you're having?
Like blurring of vision. Sometimes I cannot see the lateral sides.
Okay, I see. I'm sorry to hear that. So this has been starting for the last 1 month, and you've lost your periods for the last 4 months, right?
Yeah.
Okay. So anything else you want to add in particular?
This is my important points.
Okay. So do you have any shortness of breath or chest pain or racing of the heart?
No, no.
Do you have any problems with your tummy?
No.
Any pain or discomfort? Any swelling?
No, no.
Do you have any problems with passing urine or passing stool?
No, no.
Do you have any problems with your hands and feet? Any skin changes or weaknesses or any lumps or bumps or any weight loss, anything like that?
No.
Okay. Apart from the headache and visual blurring, do you have any loss of consciousness or any problems with your speech or any kind of like weakness anywhere?
No, no.
Do you have any night sweats or weight loss?
No.
Okay. So do you have any past medical condition?
No.
Any history of hospital admission and surgeries?
No, no.
Are you currently on any medication?
No.
Okay. So are you allergic to any medication? Have any
No.
history of allergies?
No.
Do you have any past history of any family medical condition?
No.
Okay. Have you been traveling around recently?
No.
Hello? Hello?
Again?
Have you been traveling around recently?
No.
Okay. Are you in any committed relationship?
Yeah.
What do you do for a living?
I'm a teacher.
Okay. So I'm going to ask you some personal questions. I'm apologizing for that. Do you smoke?
No.
Do you take alcohol?
No, no.
By any chance, is it possible that you could be taking any illicit drugs?
No.
Okay. So what are your ideas and concerns, Mrs. Karima?
I am worried. What is the problem?
Okay. And what are your expectations from us?
I don't know.
Mrs. Karima, based on the data that you have provided, I'm having a doubt that it could be possible that you could be having what you call you have lost your periods since 4 months and you're having a headache, and as well as you have lost your vision on the lateral sides, as you have mentioned. It could be what we call growth in one of the glands of the brain. So I'm going to take you with me to the observation room. I'm going to do a thorough physical examination, including your nervous system, as well as run some blood tests and involve my colleagues from the neurology, and also request for a scan of the brain to see if it is got to do with anything, a growth in the brain or not. So, and we'll also, by this process, we'll be able to rule out some differentials. And is that understood?
Yeah, yeah.
Do you have any questions for me?
It's okay. You can continue.
Thank you, Mrs. Karima, for all your time, and I wish you a quick recovery. I'm going to wash my hands and take off my PPE. Thank you. Hello.
Okay, thank you, Dr. Gia. Today you finished early.
Yes, doctor. I think I've missed out something.
No, you did very well. I think you did very well. But as I told you last time, with more practice, you will finish early. Okay.
Yes, doctor.
Yeah, well done. And you ask the most relevant questions, right?
Yes.
This is what I need from you. Also, your questions well phrased than before. Okay. Yeah. So this one, what is the problem?
It could be pituitary macroadenoma or something.
Pituitary adenoma. Okay. So any amenorrhea, it can be pregnancy. You have to rule out pregnancy. Okay.
Yes.
Did you ask me about
No.
any vaginal discharge, bleeding, any spotting of bleeding?
No, I forgot.
Yeah.
I forgot that completely. That oral contraceptive pills or anything.
Genitourinary here, very, very important. Okay.
Yeah.
And any previous miscarriage. Okay. So any pelvic pain or any menstruation, you have to ask about OB-GYN, obstetric and gynecological, and the sexual history. Okay.
Actually, Dr. Hani, this is the first time I'm appearing for the station, and I was thinking that I'm missing out something. I should not be finishing so quickly.
Okay. Yeah. So I updated the new stations, guys. We can put OB-GYN in genitourinary. So number one in systems, genitourinary. So do not forget, you can put in genitourinary, right?
Yes, absolutely.
Yeah,
absolutely.
So you can ask any tummy pain, any any change in genital area, any vaginal discharge or spotting of bleeding within 4 months. Okay, and also you have to ask about ministerial
history.
Yeah, ministerial. Was your period because already stopped? Was your period regular? Was it heavy or light? Any previous miscarriage? Any previous pregnancy, and so on. Okay. So here, what is your concern? I am worried. Blah 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 blah. I appreciate your concern. According to your data, the most likely problem, I'm sorry to tell you. Is it good news or bad news?
It's the bad news.
I'm sorry to tell you, the problem is in your brain. You should say most likely problem, because until now you are not sure. The most likely problem in your brain, in gland which is called the pituitary gland. Maybe it's a mass. So we need to rule out that by head imaging, which is called MRI. Okay, and we need to do examination, including your eye examination, and examine the back of your eyes by fundoscope. Okay, clear, guys?
Absolutely, yeah.
Okay, and do some blood tests, including hormones. Okay, we need to rule out other hormones like thyroid gland also. Okay, we need to rule out pregnancy. So you have to ask here, are you taking any contraceptive pills? Okay. And here, are you in a stable relationship? Yes, because maybe she's not married, maybe she has no relationship, right?
Yeah.
Okay. Are you currently sexually active? maybe she is not active at all. So pregnancy unlikely. Okay, so you have to ask about, are you currently sexually active? Okay, even you will not ask here about, are you in a stable relationship? No need. The most important, are you currently sexually active? Yes. Done. Okay, so likely to be pregnant. If she said no, unlikely to be pregnant. Okay, guys.
Okay.
If she has tummy pain, where? And if right or left iliac fossa, so likely to be
Ectopic.
ectopic. Excellent.
Yeah.
This how to expect the station, guys, and how to get high mark, inshallah. Okay. Thank you, Dr. G. Dr. Ikra? Dr. Ikra?
Yes.
Yeah. You have 30 seconds.
Okay.
You can start.
First of all, I will wash my hand and wear PPE. Good morning. My name is Dr. Ikra Khalid. I am one of ETD Star. Can I have your name and age, please?
Yeah, Karima, 43.
Nice to meet you, Mr. Kareem. I have to take you some data from you. Would it be okay for you?
Okay.
Anyone attending with you?
Yeah, it's okay.
Would mind if a staff attend with us as a chaperone?
Okay.
Do you have any pains, or I can offer you some painkiller?
It's okay.
And first of all, I need to check your vital signs. So I will move to the resuscitation room and see your vitals. Is vitals okay? Is vitals okay? Mr. Cream, Creema, can you tell me about your? Can you tell me how can I help you today?
Yeah, I have nose bleeding, doctor.
I need to move the patient to the resuscitation room and check vitals. Can you tell me more about your nosebleed?
Yeah, I found my boss nostrils bleeding suddenly. I was watching TV.
Okay, and when did it start?
Yeah, 1 hour ago.
And do you have still nosebleed?
No, it stopped.
Okay, and do you have previous episode of same bleeding?
2 times before, yeah.
Okay, and do you anything make it better?
I don't know. No idea, doctor.
Anything make it worse?
No idea.
And how often it is?
Only today, 1 time.
Okay, on one time. And can you tell me that there any other side of the body where you get bleed?
No bleeding from other orifice.
Other orifices. And how much bleed do you have?
I cannot describe. What do you mean, doctor?
A cup, a teaspoon, and or a bowl.
Yeah, it's like teaspoon.
Okay, or does it mix with the secretion or is it frank blood?
Again,
Does it mix with some sort of secretions or with a frank blood?
it's fresh blood,
Okay. What was the color of the blood?
red.
Okay, red. And do you have any headache or any dizziness?
No,
Any shortness of breath?
no,
Any chest pain?
no,
Any heart pressing?
no,
Any tummy pain or nausea, vomiting?
no,
And any discoloration of your yellow discoloration of your eyes?
no,
And any change in your bowel and bladder habits?
no,
Any change in your urine color or urine frequency?
no,
Any skin rash or any other muscular pain?
no,
Any recent illnesses?
no,
Are you suffering from any medical condition or any recent hospital admission?
Yeah, I have before high blood pressure and heart disease also.
Okay, are you using medication for high blood pressure or and for your heart disease?
Yeah, they gave me medicine like they said blood thinning medication, and they gave me medicine for hypertension also.
Okay, so you are using it in a daily routine.
Yeah.
Okay, and any previous surgeries or any scanning, imaging, and
No,
okay, and any drug history? Any drug history like other than blood thinning agents and hypertensive drugs?
yeah, I
Like
have, I have before 2 weeks ago chest infection, and they gave me antibiotic for that.
okay, and any allergic history?
No,
And where do you live and whom do you live?
I'm living with my husband downtown.
Okay, what do you do for your living?
I'm a teacher.
Okay, and now, sorry, I have to ask you some question. Would that be okay for you? Do you smoke
No,
or drink alcohol?
thank you. Excellent, Dr. Ikra. So you did very well. Here, just ask the most important questions, okay? And try to phrase your questions also. It will save time. You can ask
Okay.
the question 10 words, you can ask 5 words only, okay? So instead of saying any drug history, you can say any prescribed medication. If you instead of you can ask for 5 words, you can say 2 words, okay? Anyway, here nose bleeding, maybe blood disease, maybe blood thinning medication, maybe trauma. Did you ask me a bit about trauma?
No, I didn't.
Okay, so here, number 1, don't wait for response from the examiner. You ask me about vital signs many times, right?
Yes.
I can hear you, but I don't want to answer, okay? Because this happened in the real exam. The examiner, sometimes he will not answer you, he will ignore you. So don't wait for his response, okay?
Okay.
Yeah. So once the patient will tell you the complaint, you can move him to resuscitation room. Excellent. Any bleeding, guys, don't forget that. Any bleeding, I am sorry to hear that. I want to move you to resuscitation room and check your vital signs. Okay. Excellent, Dr. Ikra, you did that. But you did that before you asked me about my complaint. You have to ask me about the complaint first. Okay, it will be logic.
Okay.
Yeah, you did very well. Just accelerate your tone, and with practice, you will be faster, inshallah. But your approach is organized. Okay, so what is your management plan, Dr. Ikra?
Sir, I will move the patient to the observation room and do some blood test and general physical examination. And along with the blood test, I will do bleeding time, clotting time, and PTA, PTT. And after that, I will consult
So you can concise
cardiologist.
that.
And
You can concise that. You can say, I will do blood profile, right?
okay.
I want all people, you can sit with yourself, how to concise the approach. And also the patient doesn't know BTT, ATT, he doesn't know that, right? So
Okay.
instead of you say, for example, FPC, you can say full blood count. The patient understand the full blood count, but he will not understand FPC. Okay, so I hear what is your concern. I am worried. What is the reason behind that? Why I have bleeding? I appreciate your concern. You said you have history of high blood pressure. It can be the reason. You said you are using blood thinning medication. It can be the reason. This is how to talk with the patient, like we are doing in practice.
Okay.
And also, recently, you started antibiotic. Maybe this increased the effect of blood thinning medication. Okay, we need to rule out other causes or other problems. I will keep you in resuscitation room, insert IV access, okay, and also I will give you some fluids. The patient has bleeding, so you have to give him fluids, whatever, and also do some blood tests, including group and saving, cross match, blood profile. Any bleeding fixes that. Group and saving, cross match, and blood profile. Easy and simple, and the actor or the examiner will understand that you are professional. Okay. Okay, well done. So I will review your medicine. You have to mention that also. Okay. Next one, Dr. Dr. Omar. Dr. Omar. Dr. Amjad.
Yeah, Dr. Hani, hi.
Welcome. Okay. Here, Mr. Karim, he did tonsillectomy and he came back for bleeding. You have 30 seconds. You can start.
Okay. Good morning. I'm Dr. Amjad, the registrar. May I know your name and age, please?
Karim, 21 years.
Nice to meet you, Mr. Karim. I have been asked to take some data from you. Is that okay?
Okay.
Okay. Anyone attend with you?
No.
Would you mind if a nurse attend with us?
It's okay.
Are you comfortable? Do you have any pain now?
I have bleeding, doctor, from my mouth.
Oh, I'm sorry to hear that. I need to move you to the resuscitation area, check your vital signs. Are you currently bleeding?
Yeah.
Okay. Sorry to hear that. We will give you some IV fluids. We'll take some blood tests, and we'll give you medicines to stop the bleeding. Is that okay?
Okay, the bleeding stopped.
Okay, great. So, Mr. Karim, can you tell me more about your bleeding?
Yeah, I was discharged in the morning, and they give me instructions, and I followed all the instructions, you know, and suddenly I found the bleeding increased, worsened.
Okay, I am sorry for that. So you have recent surgery
Yeah.
for your tonsil. Yeah, sorry for that. And how much is the bleeding? Like, is it too much? Like it will fill a teaspoon or a cup or more?
Yeah, like cup, doctor.
Like a cup. And what is the color of that bleeding?
It was red with clots.
Red and clots. Okay. And were you bleeding? I mean, this bleeding is continuous or on and off?
Yeah, it was continuous.
Okay. And do you have any bleeding from other sides, like your nose or other orifices?
No, no.
Okay. Okay. And Mr. Karim, do you have this one? Any other symptoms that you want to tell me about?
No.
Like, okay. Do you have any tummy pain? Any yellowing of your eyes?
No, no.
Okay. Any change in urine?
Normal urine.
Normal. Okay. Do you have any rashes or any skin changes?
No.
Okay. Any high temperature or night sweats?
No.
Okay. Any recent loss of weight or appetite?
No, no.
Okay. Any chest pain, heart racing, or dizziness?
No.
Okay. Any shortness of breath or cough?
No.
Okay. And have you lost your consciousness?
No, no.
And do you feel any headache?
No.
No. Okay. And do you have any previous diseases?
Yeah, they said I have blood disease, but I cannot remember, doctor.
Okay, okay. You have a blood disease. Can it be like hemophilia or von Willebrand disease or?
Yeah. Von Willebrand disease, yeah.
Von Willebrand, okay. And do you take any medications for that?
I cannot remember, doctor.
Okay. Any previous surgeries?
No. Only this one.
Only the tonsillectomy, okay. And are you taking any prescribed medications?
No.
Okay. Do you have any allergies to medication?
No.
Okay. Any disease running in your family?
Yeah, I remember my uncle has same blood disease, yeah.
Okay, okay. And where do you live and whom do you live with?
Yeah, I was my wife in downtown.
Okay. And I'm sorry to ask you this question. Do you smoke or drink alcohol?
No.
Okay. And by any chance you use any illicit drug?
No.
And Mr. Karim, what do you do for a living?
I am studying.
Okay, okay. So, Mr. Karim, you have this bleeding following your tonsillectomy operation, and you have a history of von Willebrand disease. What is your concern regarding this one?
Yeah, I was worried, doctor. What is the problem?
Okay, okay. I appreciate your concern. And if there's anything else you want to add?
No.
Okay. So, Mr. Karim, according to your data, the most possible cause of your bleeding is your von Willebrand disease.
Thank you.
Thank you.
Thank you. Okay, well done, Dr. Amjad. You are doing very well. Your approach is very organized. You are confident, but you have many pauses.
Okay.
Okay, like you said, you are doing okay. So this wasting your time. Okay.
Okay, I will work on that.
Yeah. Also try to accelerate your tone, but your approach is logic, organized. Okay. I will give you 30 seconds to give me a differential diagnosis and the management plan.
Okay. So, Mr. Karim, according to your data, the most probable cause is your blood disease. But there are other causes we need to exclude. I am gonna keep you in the resuscitation room, do some blood tests, and give you IV fluids and medications. We'll do the blood tests, including group and saving, cross-matching, and coagulation profile. We may need to involve our ENT surgeon. And is that okay with you?
Okay.
Okay. Okay. Thank you,
Thank
Mr.
you.
Karim.
Thank you, Dr. So I need to keep you in resuscitation room. Insert, you can say cannula or IV access. It's known for the patient. All patients, IV access. Okay. Give you some fluids. Also do some blood tests, including group and saving, cross match, and blood profile. And we need to correct any abnormality. Done. No need to go deep. We need to correct any abnormality. Okay. And you will consult here ENT or hematology?
Hematologist.
Hematologist. Because the problem not in the surgery, right?
Yeah.
Yeah. And from the start, anyone has bleeding, I need to move you now to resuscitation room, insert IV access, and take some data from you. Control the bleeding, sorry. Insert IV access, control the bleeding, and take some data from you. Okay, guys?
Dr. Hani, in this case,
Yeah.
I will both specialties.
Your voice is not clear.
In this case, I will consult both specialties because it's recent surgery and also the hematology, ENT and hematology, both of them.
No worries. If you will consult the boss, no worries. But here, the problem, if he mentioned that he doesn't have blood disease, he doesn't have blood thinning medication, he doesn't have trauma, he doesn't have any clear cause. What do you think, guys? ENT or hematologist?
ENT.
ENT. Clear, guys?
Tertiary bleeding.
But if he said, I have blood disease, so what is the most important?
Hematology.
Hematologist, okay? But if you will mention both specialties, no worries, okay?
He mentioned that clearly he have one well-born disease.
Yes.
Do we need to give him before waiting for the lab result well-born factor?
Yeah, here at least you will control bleeding more than enough. If you will mention I need to control your bleeding now before taking data, more than enough, okay? But in the management plan, I will do a blood profile and correct any abnormality. Maybe after blood profile, you will find everything normal. So it's not the blood disease. It's not the reason, right?
Okay, sir. Correct.
Yeah. So always give possibilities. The examiner is not testing your knowledge, but at least he's testing how to deal with the situation, how to communicate, how to show your skills. Okay.
Okay, sir.
Yeah. Welcome. Okay. Next one.
Hello, Dr. Hani.
Yeah.
Excuse me.
Yeah.
Yeah, please, Dr. Annie, for the bleeding stations, I want to know, we're using the Odipara approach. Is it just the eye for the intensity we would ask questions about, or we'll ask everything on Odipara with intensity?
Yeah, you will ask about Odibara, the onset duration, and once you reach the eye intensity, you will ask questions of bleeding, okay? It's up to you if you want to ask about questions of bleeding in eye intensity, or you want to ask in associated symptoms, no worries, here or here. But the most important, fix one approach, okay?
Okay, so we go through the entire Odipara and still ask for intensity in bleeding.
Yeah.
Okay, thank you.
Welcome. Okay, next one, guys. Dr. Aziz.
Yes, assalamu alaikum.
Alaikum assalam. You have 30 seconds.
Okay.
You can start.
Good evening. I am Dr. Aziz, Emergency Department Registrar. Please, can you tell me your name and age?
Kareem, 43.
Nice to meet you, Mr. Kareem. I was told that you had vomit with blood, and I have to take some data. It will be okay?
Okay.
I will, please, can you tell me how I can help you today?
Yeah, I have vomiting blood, doctor, 3 times today.
Very sorry to hear about it. So I will shift you to resuscitation room. I will put for you IV line, and I will give you some IV fluid if it will be needed. So, Mr. Karim, can you tell me more about your vomiting?
Yeah, I vomited 3 times today. Each time was bleeding.
Okay. So please, can you tell me how it start?
Suddenly.
Okay. As you told me, you vomit today 3 times. So how much hours you are having now that you are vomiting?
Again?
For how much time you are vomiting now? When did it start?
You mean when did it start?
Yeah.
Yeah, in the morning.
Okay. So last time when you vomit?
1 hour ago.
Okay. So when you are vomiting, there is anything else with the vomiting, or only blood is coming?
Blood.
Okay. So anything which is increasing it?
No idea.
Anything which can decrease it?
No idea.
Did you have before the same episode?
This is the first time.
Okay. So please, can you tell me, do you have any abdominal pain? Any tummy pain?
Yeah, I have tummy pain in here, epigastric area.
Okay. So as you told me, you vomit 3 times. So how much blood it came? Can you tell me it was spoon or it was cup?
It's like a cup.
Okay. So it was fresh blood?
Fresh blood.
Any clots were with them?
Yeah, some blood clots.
Okay. Any change in the bowel movements?
No.
Okay. So any problem with urine?
Normal urine.
Do you have any chest pain?
No.
Any heart racing or dizziness?
No.
Any skin rashes?
No.
Okay. Do you have high temperature?
No.
Night sweats?
No.
Okay. Did you lose appetite
No.
or any weight loss?
No.
Please, can you tell me, did you had any faintness?
No. No.
Any headache or neck pain?
No.
Any jerky movements?
No.
Okay. Please, can you tell me, do you have any past or recent medical illness?
No. No.
Any past surgery?
No.
Are you using any prescribed medicine?
I'm not using, but I'm taking sometimes painkiller because I have headache in the last 2 weeks.
Okay, very sorry to hear about it. Do you know the name of the medicine? What medicine you are using?
Voltaren.
Okay. You are not using any blood thinner medicine like aspirin, Plavix, or warfarin?
No. No.
Any disease running in your family?
No.
Are you in a stable relationship?
Yeah.
With whom do you live?
With my wife in downtown.
Okay. Are you smoking?
No.
Are you taking alcohol?
No.
By any chance, are you taking any illicit drugs?
No.
What do you do for a living?
I'm a teacher.
Okay. Are you sexually active?
No.
Have you traveled recently?
No.
Mr. Karim, can you add something more?
Is it serious, this one?
Yes, if you are vomiting and vomiting is blood, of course it is serious. But by taking data, vomiting with blood, there are different reasons for it. There can be some problem with the stomach. There can be some problem with the esophagus. Some problem can be with the veins. But according to your data, it looks that you take painkiller like Voltaren, which can cause some erosion in your stomach, and it can bleed like this. So now I will keep you under observation. We will do all the blood investigation, like complete blood count, group and save, and cross match. And if needed, then we will do accordingly. And I will also give you some medicine like omeprazole for your stomach. Do you have any other question to ask me?
So I will go home or I will be admitted?
It will depend on my complete examination. I will examine your tummy and will examine your chest and peripheral vascular system, and then according to it, we will, and according to the blood investigation which we will do, then we will decide. But for time being, you will be under observation with us, and we will give you.
Thank you, doctor.
Thank you so much.
Thank you, Dr. Aziz. Thank you. Okay. Well done, Dr. Aziz. You have organized the approach. You are controlling your time. But what I need from you, try to not change the words, okay? The phrasing itself. So, do you smoke? All of us, we are saying, do you smoke? No need to say, are you smoking? Okay?
Okay.
Anything written in the PDF, please don't change. Okay? I'm giving you the good expression. If I say, do you smoke, drink alcohol, or by any chance use any illicit drug, ask like that. Okay? 3 questions, 1 time, but not quickly. Like that, like I am doing now. Do you smoke, drink alcohol, or by any chance use any illicit drug? So, can you see how I'm asking?
Yeah, okay. It was nice actually.
Okay, so don't say, are you smoking or are you smoker? No, don't say, do you drink? Some people, they are saying, do you drink? Drink what? Drink water or drink what? Okay, so you have to be clear lesson. So please, anything written in the PDF, try to mention same. Okay, but anyway, you did very well. Here, this patient, you have to use Blatchford score, and also any patient with bleeding, all patient with bleeding needs camera scan. I'm talking about upper GI bleed or lower GI bleed. Okay.
Yeah.
Blatchford score more than 0 needs endoscopy. Okay, but the difference now or within 24 hours, it depends on Blatchford score, right?
Yeah.
So Blatchford score, 2 blood tests required, hemoglobin and urea. So what we are gonna do now, I'll examine you, do some blood tests, including for blood count and the kidney function, kidney and the electrolyte function. Okay. Also, group and saving, fixes that in any bleeding. Group and saving, blood profile, and cross match. I will give you some fluids into your veins. I will consult. You can say if you feel the station with liver, the patient has, for example, liver disease, so hepatologist. If you feel the station not related to the liver, so for example, peptic ulcer, so you can say gastroenterologist specialist. Okay, guys?
Okay.
You can fix gastroenterologist with any upper GI bleed to be in safe side, and no need to think in the exam. Okay, well done. Dr. Ihab?
I have a question, if you don't mind. Can I ask?
Yeah, sure.
Yeah. So I have some confusion regarding taking the patient to a resuscitation room or to isolation or wearing PPE. I can see some students mixing up. Like this case, it's a history taking station, okay? And the patient is coming with vomiting, okay? We don't know from the beginning how much is vomiting, what is a vital sign, and so on. So we don't know how to decide whether to put him in resuscitation immediately or afterward, okay? So I believe that this is a history-taking station, and it's not like it's not like resuscitation station or ATLS station. So I believe that it's okay to take a history and not to shifting the patient to a resuscitation room. So what do you think regarding that?
Okay, so I will ask you another question. So you are asking about this station particularly, or you are talking about all station in general?
I want to know about all the station in general, because some like the previous station, patient had blood after tonsillectomy. We don't know the amount, and they immediately said take the patient to resuscitation room. And and the other station, like patient coming, I don't know what he came on, and immediately I will put you in isolation, and I will wear PPE for urethral discharge or something. So I feel like confused. I don't feel like I need to take the patient to isolation if he's coming with the urethral discharge or
yeah, with urethral discharge, I heard that, and it's not a big issue if he took the patient to isolation room or not. I did not comment on that. Only fever and the diarrhea you can take to isolation room, no worries. Okay, but I mean, if the patient has something serious, you have to move to resuscitation room, right? For example, Heart racing. Heart racing, you have to check the patient in resuscitation area. Okay. Also, chest pain. You have to move the patient to resuscitation area and to connect the cardiac monitor, right? You will connect the cardiac monitor in triage.
No, so I think it depends on the station. Chest
Yes,
pain and
I'm talking about serious. I'm talking about serious complaint now. Serious complaint. What does it mean, serious complaint? Chest pain, heart racing, okay? Also bleeding. Any bleeding, until now, you don't know is it serious or not. How you have four classes of hemorrhage. 1, 2, 3, 4. When the patient reach class 3, do you remember?
if there is, I don't know exactly, but if there is hypotension,
Excellent,
tachycardia,
excellent, excellent. I am
sweaty,
talking about blood
pale.
pressure. I'm talking about blood pressure. The patient will go for class 3. Can you imagine class 3? If he have hypotension, it means he can still lose 750 class 1, and his blood pressure is still normal. He can lose 1,500 and his blood pressure is still normal. Did you get my point? Okay.
Yeah.
So don't go with vital signs. No, go with the guidelines. The guidelines, for example, they said, for example, epistaxis. If you check nice guidelines, any patient with epistaxis, number 1, before controlling bleeding, number 1, IV access. You will insert the IV access, so this patient should be in resuscitation room from the start. Clear? Okay, so we are following the guidelines, not following is it logic or not logic? No. Okay, so any serious complaint, resuscitation room. Again, bleeding, all bleeding, resuscitation room. Chest pain, heart racing. Okay, so those people in resuscitation room. But other stations, like for example, sexual history, here they don't need to move to resuscitation room, but they need from you to mention confidentiality, privacy, chaperone. Did you get my point, Dr. Riyad?
Yeah. Okay, another thing that I want to ask about the chaperone. I can see some student like saying, I don't feel like sometimes logic to take the patient to, to have chaperone in a history taking station. Even if we ask about the like urethral discharge or burning micturition, do we have to have chaperone?
No, chaperone, it's not a routine. I agree with you. Chaperone in some stations, okay? So if you will talk about sexual history, you have to get chaperone also, okay? If you will examine, you have to get a chaperone, okay? Because this patient, after you take history, you have to do examination. In the management plan, you will say to the patient, I need to do some examination, including examination for your genital areas. I will do swab. So you have to get chaperone from the start. Okay?
Okay.
Yeah. But in general, chaperone in some stations or in some cases, not as a routine. But if you, for example, patient has throat pain, would you mind if a nurse attend with us? Done. No need to mention chaperone. Okay? But even if in the exam, even if you will mention chaperone, it's not a big issue, don't worry. Okay?
Oh, okay. Because the time in the exam is very, very limited. So we want to concise everything so we can do important things.
Important points, yeah. Okay. Anyone want to ask anything, or we can proceed so we can save time? Okay. Who is next? Dr. Ihab?
Yes. Yes.
Okay, Dr. Ihab Abdurrahim. Okay. Next station. You have 30 seconds. You can start.
Wash my hand. Hello, everyone. My name is Dr. Ihab, one of ED doctor. May I confirm your name and date of birth, please?
I'm Kareem, 43.
Nice to meet you, Kareem. So how can I help you today?
Yeah, doctor, I have bleeding per rectum.
So sorry to hear that. If you don't mind, I need you to come with me to the resource area. I will put IV access and check your vital, and I will take some data from you. Is it okay with you?
Okay.
Okay. I will. One nurse will be with us. Okay.
Okay.
Are you comfortable right now? Do you have any pain?
I'm okay.
Okay. So can you tell me more about this this bleeding?
Yeah, doctor. It started like, like 3 weeks, but I'm ashamed to come here. But today I couldn't tolerate it. Today it's too much.
This started gradual or sudden?
Gradual.
And this 3 weeks ago, and it is worsening or improving or the same since it started?
Increasing, worsening.
Worsening, on and off or continuous?
Yeah, each time I go bathroom, I can find the bleeding.
Okay, this bleeding, how often? This
Each time, doctor.
Each time. Okay, and this color, you can notice fresh blood.
Fresh, yeah.
And
Hello?
hello?
Yeah.
It contains clots or you didn't notice?
Yeah, fresh blood, doctor, only.
Only, okay. There is any other, so sorry to hear that. There is any other bleeding from other orifice you notice?
No.
So anything make it better or worse?
No idea, doctor.
Okay. But do you have any tummy pain? Is it?
Yeah. Sometimes again.
Tummy pain. And did you feel sick or throughout?
No.
Do you notice any change in your skin or yellow discoloration of your eyes?
No.
Do you have any change in your urine?
No.
Did you notice any temperature, high temperature?
No.
Did you lose weight or lose weight, appetite?
Yeah, I noticed I lost like 30 kilogram within 6 months.
So sorry to hear that. And did you have any lump or bump in your body?
Yeah.
Where?
Yeah, in axilla.
So sorry to hear that. And what about did you notice any change in your skin or rash?
No.
Did you have any heart racing or easy fatigue or dizziness?
No.
Did you have chest pain?
No.
And did you notice any cough or shortness of breath?
No.
And do you have any past medical history?
No.
Any previous recent surgery?
No.
Any prescribed medication?
No.
Any allergy?
No.
Do you have any? Do you have family family history of run? Do you have a family history disease run in your family history?
No.
Okay, and did you travel recently anywhere?
No, no.
Where do you live?
Was my wife in
Which home?
downtown?
And what do you do for living?
I'm a teacher.
Do you smoke or drink alcohol?
No.
And so sorry for next question. By any chance, do you take any illicit drug?
No.
And do you, after I take this data from you, do you have anything to add?
No.
Okay, Mr. Karim, what is your concern?
I am worried. What is the problem? Do I need any imaging?
Your concern is appreciated and genuine. Actually, from the data I collected from you, most likely you have, we are worried about this serious cause of, because you said you have also lump in your axilla. We are worried about, I'm so sorry to tell you that we are worried about you have maybe malignancy this in your abdomen, but we need to, I will do full clinical examination for you. I will examine your tummy, I will examine your anal canal as well, this back passage, and I will extract blood from you. I will do
Thank you.
tumor marker.
Thank you. Okay. Well done, Dr. Amjad. You did very well.
Ihab.
Okay. Okay. Excellent, Dr. Ihab. You did very well. And regarding the time, just focus on the most important points, and also don't go deep in each question. Okay. So try to accelerate your tone as well.
Okay.
Yeah. Anyway, we are practicing within 6 minutes, but I want you to be very comfortable in the exam, inshallah.
It's my first time.
Okay. Well done. So here, what is the most likely problem?
Actually, from the data,
yeah,
we need to do scan to his tummy, and I'm worried about rectal. I need to do stool for occult blood. I'm worried about most serious tumor in his colon.
Yeah, I want you to be concise with yourself. I ask you one question. What is the most likely problem?
Most likely, but
what is the most likely problem, guys?
Malignancy.
Thank you. Malignancy.
Yes,
I want you to be simple, guys. I want you to be simple in any exam. Try to be simple. Why you make everything difficult for yourself and for others? Okay. So I appreciate your concern. According to your data, the most likely problem is malignancy. Done. Okay. If you want to summarize more, no problem. You lost weight, and you have blah 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 blah. Okay. So what we are gonna do now? I will do examination, some blood test. Also, you can do camera scan, because any bleeding, camera scan. Okay. I'm talking about GI bleed. And we will consult who?
Gastroenterology.
Gastroenterologist. Okay. Okay. You will do a blood test, including full blood count, also group and saving, blood profile, and cross match. You will give him some fluid into his vein. So fix a general management for any bleeding, guys. It will help you, but be simple with yourself. Don't make complicated. Okay. Excellent, Doctor. Next one, Dr. Nasser.
Yes.
Welcome.
How are you, Dr. Han?
Alhamdulillah. You have 30 seconds. You can start.
Hello, I'm Dr. Nasser. May I know your name and age, please?
Kareem, 43.
Nice to meet you, Karim. How I can help you today?
Yeah, I found the blood when I'm passing urine, doctor. I'm really worried.
Oh, sorry for that, Mr. Karim. Anyone attend with you?
No.
Would you mind if our staff nurse attend with us?
It's okay.
Okay. Do you have pain right now to give you painkiller?
No pain.
Okay. Mr. Karim, I want to ask you a couple of questions regarding your blood and urine. That okay with you?
It's okay.
Okay. Can you tell me what happened exactly?
Yeah, it's like 2 weeks, doctor. I can find the bleeding when I'm passing urine. In the start, it started gradually, and every day it's increasing. Today I found the fresh blood when I am passing urine. There is no pain at all.
Sorry for that. Sorry for that. You told me you start 2 weeks and it's gradually.
Yeah.
Okay. It is affecting your daily living?
No.
Can you estimate for me how much is it? Is it like cup or spoon or what?
Yeah, in the start it was like a teaspoon, but today it's like half cup.
Oh, sorry for that. What's the color? Is it dark or fresh blood?
Fresh.
It is containing blood. It's containing clot.
No.
It is started in the before your urine or after your passing urine, or all through.
Before, during, and after, doctor.
Okay. Do you have any difficulty to pass urine?
No.
There is any pain when you told me there is no pain with when you passing urine. Okay.
Yeah.
Okay. Good. Do you have any? What about bowel work? Do you have any
Normal.
dysmotion or? Okay. Do you have fever?
No.
Weight loss? Do you have weight loss?
Yeah, I lost like 30 kilogram in the last 6 months. Yeah.
Oh, it is genuine. Do you feel any loss of appetite recently?
Yeah.
Do you have night sweat?
Yeah.
Do you have any lump in your body?
Yeah.
Do you have any chest pain or heart racing?
No.
Do you feel dizzy or faint?
Sometimes
fainting?
I feel dizzy. Yeah.
Oh, sorry for that. Mr. Karim, do you have any loss of conscious or jerky movement?
No.
Okay. Do you have any weakness?
No.
Apart from this symptom you mentioned, there is any other symptom you want to add?
Yeah. When I'm doing defecation, I can feel pain.
Oh, sorry for that. And there is no blood with defecation.
No.
There is there is no other bleeding from any other side.
No.
Okay. Mr. Karim, do you have any past medical history?
No.
Past surgical history?
No.
Do you taking any regular medication?
No. No.
Including blood thinner medication?
No.
Okay. Mr. Karim, do you have allergy to anything known to you?
No.
Okay. Anything, any disease running in your family?
No.
What do you do for a living?
I'm not working.
I'm sorry for that. With whom you are living and where?
I'm living alone.
Okay, for that. Do you smoke, Mr. Karim?
No.
Do you drink alcohol?
No.
By any chance, do you use any recreational drug?
No. No.
Okay. Do you travel recently?
No.
Are you sexually active?
No.
Okay. Do you? What's your concern and what you expect?
I'm not worried, but give me medicine for this bleeding and I will go home.
Sorry to tell you that, Mr. Karim, your from data I collect from you, I'm worried to tell you, but I have
Thank
very
you,
bad
Dr.
news.
Nasser. Thank you. You finished your time. You are amazing. You are amazing, but you have to accelerate your tone. I will give you 20 seconds to continue.
Yes, from the data collected from you, we need to rule out serious condition like malignancy, because you have gradual and prolonged bleeding and loss of weight and lumps in your body. For that, we need to do for you full clinical examination. We'll shift to research room and we'll do for you full clinical examination and we'll run blood tests, including blood thinning, blood bleeding profiles, and we'll need to do for you scanning to your tummy, and we'll consult urology, and even if diagnosed confirmed, we need to refer you to oncology clinic. That okay with you, Mr. Karim?
Okay, thank you, Dr. Nasser. Okay, well done. Okay, so here, this station typical in previous exam, the actor, he said, just give me medicine for the blood and I will go home. Okay, this patient, do you think he will be admitted or discharged?
You should be admitted, this patient.
Or just a consultation for which is specialty, guys?
Urologist.
We need admission because there is no social support. He's living alone, and his complaint is may deteriorate.
Yes.
And
so
we need to consult a multidisciplinary team, including urology and.
Excellent. So here it's not clear that which is specialty, okay? But you have to inform him according to your data. I'm sorry to tell you, it may be if something is serious, show the actor or the patient. It may be okay, or it might be. So it might be malignancy, but we need to confirm that and rule other problems. I will keep you in resuscitation room because it's bleeding, and insert IV access, give you some, take some blood for blood group and saving, full blood count. Also, of course, a full blood count mandatory, guys, for hemoglobin. full blood count, yeah, group and saving, cross match, and the blood profile. Okay, so here you cannot confirm malignancy now. Okay, but at least you will rule out anemia. You will rule out also blood disease. You will check if the patient needs blood transfusion or not. Okay, some people they are stable in front of you, and you will find their hemoglobin 4 or 3. I found one patient coming walking alone, and his hemoglobin 2. Can you imagine, guys? So you cannot decide discharge or admission until you finish examination, until you finish blood results and see. You can tell him if all blood results give always possibilities. If you don't know the pathway of the station, you can give possibilities. Okay, and this will give you marks. The examiner is testing your skills, not your knowledge. So if all results and the examination normal, so I will arrange appointment with oncologist. So I will give you treatment here, and I will arrange appointment with oncologist. But if lab results abnormal, we will admit you. Okay, so you have to give possibilities, this pathway or this pathway. Anyway, excellent, Dr. Nasser, but accelerate your tone. Dr. Ines.
Assalamu alaikum, Dr. Hani.
Yeah.
Yes, in my exam last November, the same station was bleeding with urine hematuria due to warfarin. And patient was old age, and he has atrial fibrillation in the past medical diseases. And he was on warfarin in the past drug history. So then when I came to management plan, I inform in the diagnosis, I tell him it's most likely due to your blood thinning medication, warfarin. And then with management plan, I was telling him that we'll do blood test, coagulation profile, and full blood count, and we will consult cardiologist and we need to stop warfarin for a few doses depending on your coagulation profile. But currently you have to stop it. And then he asked me the same question as you are telling regarding, do I need admission or you will admit me?
Why you will? Why you will take decision and you did not check INR?
Yes. So I tell him the same that I will do INR and coagulation profile, and depending on that and depending on cardiologist consultation.
He knows about INR?
No, there is no INR in the lab.
No, I mean the patient is aware about INR.
No, maybe he don't know about INR. Yes.
Why you say maybe? You have to ask him.
Yes.
Are you checking?
So I will.
Are you checking
I
your
have
blood,
to ask him about INR also. Okay. Yeah. No, I did not ask him that. Are you checking your coagulation profile? I inform him that I will repeat like coagulation profile and full blood count and all other labs to adjust the dose for warfarin.
Okay. Anyway, as we said before, any station for bleeding, you have to think about blood disease, blood thinning medication, trauma. Dr. Nasser did not ask me about trauma. Okay.
Yes.
And any bleeding, trauma. You have to rule out the upper or lower GI bleeds, nose bleed, post-tonsillectomy, also urine with blood. Okay, so you have to rule out blood disease, blood thinning medication, trauma, and also other drug interaction. Okay.
Yes, exactly. As if antibiotic will affect.
If the patient is using blood thinning medication, are you compliant with your medicines? Are you taking them regularly as instructed? Okay. If yes, are you doing regular checking for your blood profile? Yeah. So Are you aware about INR? Yeah, yeah. When
Yes,
the last
exactly.
time did you check INR?
No, I did not take all this history for
Yeah.
his,
So
if he's regular with warfarin or if he
yeah,
is checking
you
his
can tell
INR.
him, you can tell him, I will do blah 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 blah, including blood profile like INR. According to the INR range, I will give you the exact management plan. Okay.
Yeah, exactly.
Yeah.
So I should not tell him that I will stop or hold warfarin for now and or omit 1 or 2 doses as per our previous knowledge
You
or
cannot tell him I will stop or withhold. Maybe INR is normal.
okay. Yes.
I cannot.
Exactly.
Yeah. So you can tell him after I will check INR, I will give you exact management plan regarding your medicines. Okay.
Yeah,
But also you have to roll out drug interaction. Do you take
yeah.
any other medicine, not only antibiotic? Because some medicine can do increase the effect or decrease the effect of warfarin. Are you taking any prescribed medicine apart from warfarin and so on? Okay.
Yes, exactly. Okay.
Yeah.
Thank you, doctor.
Welcome.
Annie, just from the practice, in a patient coming with frank hematuria, we always do put a 3-way catheter after doing bladder
Okay,
scan.
Dr. Abuha, can you raise your voice, please?
From the practice, any patient with frank hematuria, we always do a bladder scan and put 3-way catheter and wash out the bladder and admit the patient. So patient always need admission because we put a 3-way catheter, which is a big catheter, and do a bladder washout. Then the decision for discharge and follow-up will be from the urology, but always for admission if it's frank hematuria. If it's microscopic, then it's another issue.
Okay, thank you, Dr. Abu Yahya. Okay, well done. Okay, so here the next one, Dr. Ines.
Yes, I'm ready.
Dr. Ines.
Yes, yes. You can hear me?
You have problem in your mic.
Like this, is clear?
No.
My voice?
You are using speaker?
Before I'm using the scope, you told me it's not good. Now I'm using the speaker. It's good to you or?
Something wrong with your mic. So try to fix. We will go for Dr. Tariq, and after that, if you fix, we can go back to you. Dr. Tariq?
Yes, sir.
Are you happy to practice?
Yeah.
No worries?
Yes, ready.
Okay. You have 30 seconds. You can start.
I will wash my hand and wear PP. Hello, Ms. Karima. I am Dr. Tariq, one of the senior emergency department today, working in emergency. May I know your name and age, please?
Yeah, I'm Karima, 65 years.
I have been asked to take some data from you. Is it okay with you?
Okay.
Do you want someone to attend with you?
No need.
Are you comfortable at this time? Do you need any painkiller?
I'm okay.
How can I help you today?
Yeah, doctor, I have vaginal bleeding.
I'm sorry to hear. I need to take you in resuscitation room and I will give you some, I will check your vitals and I will take you some bloods. And is it okay with you?
Okay.
Can you tell me more about your bleeding? When did it start?
Yeah, I started like 2 weeks ago. It was mild. Every day it's increasing, and it was spotting in the start, but today it's too much.
Can you tell me the amount that it is like 1 spoon or there is a cup? What is the amount?
I cannot describe, doctor.
Mhm. Okay. Do you have any pain with this bleeding?
No.
Can you tell me that what is the color of the bleeding?
Yeah, fresh blood and also some clots.
Some clots, reddish in color or it's brown in color?
Yeah, I told you fresh blood and some clots.
Okay. Okay. Do you have any difficulty in passing urine?
No.
There is any dribbling or incontinence of the urine?
The normal is normal, doctor.
Okay. Do you have any? Okay. Do you have any bleeding from other side, like from your
No.
back of?
No, no.
Okay. Do you have any diarrhea?
No.
Do you have any discharge from your vagina?
No, no, no.
Do you have any tummy pain?
No.
Okay. Do you feel that there is a numbness or weakness in the lower part of the anal canal, that anal canal?
No, no.
Do you think that there is a weakness in your lower limbs?
No.
Both legs?
No.
Any rash on your body?
No.
Okay. Do you have any palpitation or heart racing?
Sometimes I feel heart racing, yeah.
There is any chest pain?
No.
Shortness of breath?
No, no.
Do you feel any dizziness or vertigo?
Sometimes, yeah.
Do you feel any dizziness or vertigo?
What is vertigo?
That spinning of your head. Do you feel
some dizziness, doctor, I told you.
Some dizziness. Do you feel any weakness or any pain in your neck?
No, no.
Do you have any weakness any part of the body?
No.
Okay, can you tell me that do you have any past medical history like high blood pressure, high blood sugar, or any other disease?
No.
Okay, one thing that is important, I want to ask that, is this the first time that you have this bleeding?
Yeah.
And what about your last menstrual period?
It was at 50.
At 50. Okay. And when was your first menstrual period? Start
15.
And okay, what about your screening? Pap smear? Have you ever done your screening?
I no idea.
Okay, what about before this one? All the menses were normal till the 50?
Yeah, it was normal.
Okay. Okay. Any family history of malignancy or any heart disease or any blood disease?
No.
Are you taking any prescribed medicines or any other medicines?
No.
Are you taking any this postmenopausal hormones?
No.
Any
No.
medicine? Okay. Do you feel that there is any weakness or do you feel any fever, and night sweats?
No.
Any weight loss?
Yeah, I lost my weight like 30 kilogram within 6 months.
What about your diet? Is it okay?
Yeah.
Okay. Do you smoke, drink alcohol, or taking any recreational drugs?
No.
Okay. What do you do for your living?
I am retired.
Okay. Do you need any social support?
No.
Okay, Mrs. Let me to summarize that what you told me here, that you have a bleeding from the last couple of weeks, and this bleeding is fresh and continuous, and it is an amount you don't know still, but there is a weight loss, and you don't have any
Thank
past
you,
medical.
Dr. Tariq. Thank you. Well done, Dr. Tariq. You're amazing, but you are asking too much. You are asking details. Okay, that's why you did not control your time. Again, we are practicing within 6 minutes, but it doesn't mean you will go deep. Okay. Do you have any past medical disease? Done. No need to mention about like
Blood
hypertension
pressure.
and right. So try to concise to save time. Okay. If the patient has any blood medical disease, he will say, "Sir, right?" Okay. So try to concise your questions, and your tone is fast. No worries about your tone. You are talking fast. No worries. Okay. But the problem with you, you are asking in details. Even after you finish Odibara and you went to family history, you want to go to Odibara again and to complete details, right?
No, because then I think that I have to ask the obstetric and the previous history. This was important. I have.
You
I
know,
forget that one.
all of us, before we are searching to be very complete. Okay, we want to ask every point, but this will not increase your marks. Maybe it will decrease your marks. Okay.
Okay.
Yeah.
So we have to try to complete. Yeah.
Ask the most relevant questions. Ask the most important questions, and also by simple way. The examiner, if you will say any past medical disease, it's simple and good, okay, and easy to understand. Any disease run in your family, very simple, right? So please, guys, write these questions in paper. It will be very easy for you. Okay. Okay. Well done. So this patient, what is the most likely problem?
I want to explain that three things. That there is more chances that you have we have to go for this scan of your from your
what is
vagina.
The most likely problem? Why you make difficult for yourself?
Fibroid uterus.
Why fibroid? We don't know fibroid or not. What is the most likely problem?
Cancer, malignancy.
Just it. Okay. Don't think too deep. Any vaginal bleeding or any vaginal discharge, brown discharge in old age after
serious,
menopause, it's malignancy until proven otherwise, right?
Okay. Yeah.
Okay. So I will do this station again to anyone else later. So my complaint is vaginal discharge. The patient is 65 years. So you have to ask me about the color of discharge. I will say brown. Any brown discharge, not vaginal bleeding, any brown discharge according to NICE guidelines, it's considered malignancy until proven otherwise. What are the investigations?
The scan, transvaginal scan. We will do transvaginal scan.
Transvaginal scan. What else?
We will do a full blood count, type and screening. And tummy scan, this is the one I think so. And biopsy, if there is anything, we'll take biopsy.
Baby smear.
No, according to NICE guidelines, the most important you will do transvaginal scan, ultrasound scan, and if more than 5 millimeter the thickness, you have to do histopathology. But it's not our issue now. It's not our issue now. Okay, just to mention, I will do examination, including your genital areas, and do tummy scan and the transvaginal scan. Okay, do some blood tests, including full blood count, also blood profile, prevent safe, cross match. Okay, guys, and give you some fluid, and also you will consult the specialty, relevant specialty. Okay, well done, Dr. Tar. Dr. Al-Humaidi?
Yes, doctor.
Yeah. You have 30 seconds. You can start.
Good evening. I'm Dr. Abdulaziz, ED Registrar. May I know your name and age, please?
Yeah, I'm Karima, 23 years.
Nice to meet you, Ms. Karima. I have been asked to take some data from you. Is it okay with you?
Okay.
Anyone attend with you?
No,
Is it okay if nurse attend with us as a chaperone?
that's okay.
Do you have any pain? I can give you painkiller.
I took painkiller already.
Do you feel comfortable now?
It's okay.
How can I help you today?
Yeah, I have vaginal bleeding, doctor.
I'm sorry to hear that. I will take a vital sign. I will put you in observation room. Can you tell me more about your bleeding, your vaginal bleeding?
Yeah, this one started last night, and today it's worsening.
Started suddenly?
Yeah, suddenly.
Sorry to hear that. How often? I mean, how much the amount? What is the color?
The color is red.
Any clots?
Yeah.
How many bags?
Yeah, I used like four pads in the morning.
Any bleeding from any other orifice?
No,
Anything make it worse?
no idea.
Is it continuous?
Not continuous.
This is the first time, or there is a previous episode like that?
First time.
When your last menstrual period?
It was 2 weeks ago.
Do you have any? Do you take any oral contraceptive?
No,
Do you have any painful urination, dark urine, blood in urine?
no,
Do you have any heart racing or dizziness?
no,
Or
no.
shortness of breath? Do you have abdominal pain? And do you have tummy pain? Sorry.
Yeah, I have some tummy pain in the lower part.
Since when? Started with the blood, with bleeding?
Yeah.
Do you have fever or night sweating?
No,
Do you have any past medical history?
no,
Did you admitted to the hospital before, or you have any surgical history before?
no,
Do you take any drug or prescribed drug medication? I mean,
no,
do you have any allergy from any medication or anything else?
no,
Do you have any family history
family history of what?
of any medical diseases?
No,
Are you stable in relationship?
yeah,
With whom? Do you have? I mean, do you sexually active?
yeah, I'm currently active, yeah.
With whom?
My regular partner.
Any other partner?
No,
Do you planning for pregnancy from him?
no.
When the last intercourse happened? It was protected.
Yeah,
Any do you know anything about your partner? Is he diagnosed for any sexual transmitted disease or HIV?
no idea though.
Do you have any other sexual problem? I don't ask. I missed to ask you.
No.
Do you have any history of travel?
No.
What's your concern?
I am wanted, doctor. What is the problem? Is it cancer?
Appreciate your worry. Actually, I have good news for you. It looks like not cancer. There is a lot of differential diagnosis for vaginal bleeding, including maybe you have miscarriage, maybe you have infection.
I'm not pregnant, doctor.
And you didn't take any contraceptive pills?
No.
Could be you're pregnant and you don't know about pregnancy. So we have to do some lab investigate to put you in the observation room. We will do some physical examination, and we will take some blood investigation, including full blood count and the pregnancy test also. And we will do ultrasound to your tummy, I mean imaging to your tummy. And if need, we will consult the gynecology consultation. Did you understand what I have told you?
Okay, thank you, Dr. Al-Hamidi. What is the problem here?
It's baby bleeding, maybe threatened abortion, maybe miscarriage.
Okay.
Maybe maybe trauma. I forget.
Did you ask me about trauma?
No, I forget to ask about trauma.
Okay, you took sexual history. Do we need sexual history here?
Yes.
It's not important. Vaginal bleeding, it's not important. If vaginal discharge, maybe, right?
Yeah.
But you can ask about what is the most likely problem, guys?
Ectopic pregnancy could be.
Maybe trauma.
Miscarriage, maybe fibroid.
Okay.
Fibroid.
Did he ask me? Did he ask me about? Did he ask me about OB/GYN history?
Last menstrual period.
He asked me about last ministerial period, but he did not ask me about first ministerial period, right?
Yeah.
Also,
Regular.
Any previous miscarriage, any previous pregnancy.
Outside the womb.
Yeah. At least any previous pregnancy. Okay. Also, what about previous periods? Regular or irregular, heavy or light? Okay. So how to understand it's a fibroid? Okay. You have to ask about this question. And also, when was the last sexual act? Why? Because maybe vigorous sexual intercourse, right?
Yeah.
Maybe this happened after vigorous, after hard sex. Okay, so that's why she has bleeding. Okay, so here you have to ask about OB/GYN and sexual history, but not questions of sexual history. You have to ask only when was the last sexual act and was it hard sex or not? You have to be clear. Don't be ashamed with the actor in the exam. Okay, and also here, do you have pain or bleeding during or after any sexual act? Okay, guys, I think it's clear now.
Yeah.
So the trick here in OB/GYN sexual history, 3 points. Okay, you will ask them in genitourinary, do not forget genitourinary questions. Okay, Dr. Hamidi?
Yeah, clear. Thank you.
Yeah. So what is the management plan?
As I told Doctor, we will put the patient in observation. We will insert cannula. We will take some lab investigation, and we will do tummy scan or bare vaginal scan. And if need, we will consult the
And the pregnancy test.
And including pregnancy test.
Okay, transvaginal ultrasound. Okay. So here you have to do examination, including genital areas. Maybe she has vaginal tear, right?
Yeah.
Okay.
You're right.
So you have to think about malignancy here, unlikely, 23 years, unlikely. And also unlikely because there is no loss of weight, no loss of appetite, no night sweats, no fever, and so on. Unlikely to be infection because there is no history of fever. Okay, so you have to think about trauma, you have to think about blood disease, you have to think about blood thinning medication, and so on. Okay, guys. Next one, Dr. Abdel Latif.
Okay.
Okay. So okay. So here I will change this one for you. It will be
sorry, just I want to check my voice is clear.
okay.
Now I changed to another device.
Okay. Okay, sorry, Dr. Abdel Latif, for Dr. Inas priority.
No problem. He can do it. Just I will do after him. No problem. I have time. I can wait. Just I want to check my voice is clear.
Yeah,
because
your voice is very clear now.
Okay, خلاص. After Dr. Abdel Latif, please.
Okay, Dr. Abdel Latif.
Okay, I'm ready.
Yeah, you can start.
Good morning. My name is Dr. Abdul Latif Ali, PD registrar. May I know your name and age, please?
Yeah, Karima, 65 years.
Nice to meet you, Ms. Karima. I've been asked to take some data from you. Would it be okay with you?
Okay.
Would you mind if a nurse attends us as a chaperone?
It's okay.
Do you have any pain, Ms. Karima? So I offer you painkiller.
No pain.
Okay, Ms. Karima, how can I help you?
Yeah, today I found the vaginal discharge, doctor.
Vaginal discharge.
Yeah.
It's only today.
Yeah, today.
Okay. Is it start suddenly?
Yeah.
Is it increasing or the same since the start?
I did not notice.
Okay. Could you describe the amount? Is it teaspoon or?
Yeah, it's like teaspoon. Yeah.
Okay. Okay. So, do you have any other symptoms like vaginal itching or pain?
No, no.
Any problem with your urination?
No.
Okay. Any tummy pain?
No.
Bowel, any change in your bowel habit?
No.
Do you have any high fever?
No.
Any weight gain or weight loss?
No.
Okay. Any lump on your body?
I did not notice.
Okay. Ms. Karima, when did you have your first menstrual cycle?
I was 14.
Was your menstrual cycle regular?
It was irregular before.
Okay, it was irregular. Do you have any children?
Yeah.
Okay. How many pregnancies you had?
3.
3. Any miscarriage or any abortion?
No.
Okay. So Do you have any heart racing or dizziness?
No.
Do you have any other symptoms?
No.
Do you have any current or past medical disease?
No.
Okay. Do you have any previous surgery?
No.
Any disease running in your family?
No.
Do you take any current medication?
No.
What do you do for a living?
I'm retired.
Where do you live and with whom?
I am living alone.
Do you smoke, drink alcohol, or by any chance use any illicit drug?
No.
Are you sorry for this question? Are you sexually active? Okay, sorry for that. Okay, so you have this brown vaginal discharge, and you have no any itching in your vaginal. And when was your last menstrual cycle?
It was at 50.
At 50. Okay. So since that, do you have any vaginal bleeding?
No.
And as you said, you have no any weight problem.
Yeah.
Okay. So do you want to add anything?
So what is the problem, doctor?
Okay. Of course, I have to explain to you. From the data that I get from you, your last menstrual cycle when you was 50, and since that time you have no any problem. So the most likely problem is the menopause. And did you have any vaginal screen for vaginal smear, or sorry, cervical smear?
No idea.
No idea. So okay. So the most likely your problem might be just a normal change following menopause, but also we have to think about more serious things like any cancer in your womb. So I need to keep you in observation, and I will do a physical examination, and also I will do vaginal examination, and we will do transvaginal ultrasound to see any sickness in your womb or vaginal, and also we will take some smear we'll take some swab to see what's happened.
Okay, thank you. Okay. Well done, Dr. Abdul Latif. So here I want you to emphasize on the discharge. Okay, so this discharge when happen, and also how many times today, and any bleeding with this discharge or not. Okay, and also you ask about the first and the last menstrual period. You have to ask about any previous pregnancy, previous miscarriage, and also the discharge, make local analysis for discharge. So what about the color? If even the color is brown, you can say, I have been informed that you have a brown vaginal discharge. Is that right? Yeah. So here, as we said before, any brown vaginal discharge according to NICE guidelines, it's post-menopausal malignancy until proven otherwise. So you did very well. You did analysis for everything, biologic way, and the management plan, you did very well. So you will do examination, examine tummy, genital areas, and also do tummy scan and the transvaginal ultrasound scan to check the thickness of the womb And if more than 5 millimeters, so needs to do biopsy. You have to be clear with the patient, okay? And you have to be clear with the examiner as well. You have to mention that, okay? Excellent, Dr. Abdul Latif. Dr. Ines? Dr. Ines?
Yes. Yeah, I'm ready.
Okay. Okay. So this station, you have 30 seconds.
Okay.
You can start.
Yes. Knock the door, wash my hand. Great all. I am Dr. Ines, emergency physician. May I know your name and age, please, sir?
Karim, 43.
Nice to meet you, Mr. Karim. Mr. Karim, I want just to ask you some question. It will be okay with you?
Okay.
Anyone you want to attend with you?
No need.
Can I ask my nurse to attend with us?
Okay.
You have any pain right now or you comfortable?
Yeah, I have pain. Yeah, I took painkiller.
Okay, you are comfortable right now.
It's okay.
Okay, just tell me, can you tell me how I can help you today, Mr. Karim?
Yeah, I have bleeding in passing urine.
Oh, I'm sorry for that. Can you tell me more about that?
Yeah, this before, during, and after passing urine, doctor.
Yeah, I'm sorry for that. My patient, just I need to check vitals of my patient. It is stable or not, okay? Since when this started?
Last night.
Okay, it was sudden or gradually?
Sudden.
It's associated with any tummy pain or pain during micturition?
Yeah, you have tummy pain.
And what about pain during micturition you have?
No.
Oh, I'm sorry for that. About your this, anytime you went to make your urination, there is blood coming with the urine. You told me, I'm right? Anytime, that is me constant since last night. Is this disturbing your day activity?
No.
It is large amount like fresh blood or just discoloration of the urine?
It's like teaspoon, doctor.
What you, I cannot get you.
Teaspoon.
Okay, like teaspoon.
Yeah.
Okay, and this happened to you before or this first time?
First time.
Okay, Mr. Karim, you have any other high temperature and other symptoms like high temperature?
No.
Headache?
No.
Heart racing?
No.
Okay, any urine discharge other than blood? Urethral discharge? Okay. Any, you are feel sick or throughout?
No.
Any, you have any past medical history before? Chronic illness?
No, no.
And you are using any chronic medication like blood thinner?
No, no.
You have any allergy before to some food or medication you are using before?
No.
And any disease run in your family?
I did not notice.
Okay. What you are doing for a living?
I'm a teacher.
You are a smoke?
No.
Drink alcohol?
No.
By any chance you are using any illicit drug?
No.
And you are in a stable relationship?
Yeah.
You are active, sexually active?
No.
You mean you haven't now sexually active with any partner? Okay, sorry, just I want to ask you some more question. You have any loss of weight or lump in your body?
No.
Okay. What's your concern about this?
I'm worried, doctor. What is the problem?
You haven't any trauma before, Karim?
Yeah, I was playing football the other day, and I fell down, but I don't know. Is this the problem?
It could be. There is any swelling in your private area?
Yeah, I have a swelling in pelvic area. Yeah.
Yeah, there is ecchymosis. There is bleeding from any other side.
No bleeding from other side.
Okay. Karim, I want from the data I collected from you, I want to shift you to observation room. I will do for you head-to-toe examination. Include that I will be in private room. I will ask some chaplain with us to examine your private area well, exposing, including inspection, palpation, and we'll take some run blood test for you and some imaging in your tummy and your this area, like imaging for this area. My concern is like it is related to the trauma you have. We need also to see, and after that we try to include the concerned department as urology to see what the problem. It's okay with you?
Okay.
Okay. Any question you want me to ask? Anything I can help you?
So any fracture or any abnormality in my urine tract?
We will see that when we are doing some.
Thank you. Okay. Thank you, Dr. Ines. Well done. You're amazing. But you forget about the trauma, but you remember in the end, it's not a big issue, but at least anything you will remember, you have to mention at the moment. Okay. Yeah. So this one you have to check pain. Where is the pain? Right?
Yes, you told me lower part of tummy. I ask you.
Yeah.
But I'm not.
No, I'm not talking about you. I'm talking to all. Okay. You have to ask about the site of the pain, because the site of the pain will give you idea about, for example, where is the injury. So maybe the injury in bladder, maybe the injury in the kidney, maybe in the ureter, maybe in the urethra. Okay. So this patient may need a ureterogram, right? Okay. So in a way, it's not our issue now. The most important, you have to do examination, inspection, palpation, percussion, and also you have to do tummy scan and examination including genitals as well. Okay. So management plan, painkiller, and refer to urologist now. Okay. Don't discharge. Excellent, Dr. Ina. Next one, Dr. Ahmed Al-Amin.
Yes, Dr. Hani.
Yeah. You were in the start, and I told
Yes,
you.
I had a gush of patients followed by a bad connection. So I was kicked to the end.
Okay.
Okay.
So this is the last station. It should be Dr. Abu Yahya, but maybe Dr. Abu Yahya, he went already. Okay.
Dr. Hani, I'm sorry to disturb just before to start the new. Doctor, regarding this bleeding with urine, when I ask, can I know more? Can you tell me about that? The patient itself, he will not tell me about the trauma history. I need to ask about that.
If the patient tell you about the trauma, it will be finished.
Yes, this is my point here. He came concerning about bleeding, blood coming with urine, and he told me there is blood coming with urine, and I am asking, what? Can you tell me more about that?
Yeah, this can happen in practice. This can happen in practice.
Okay.
Some patients, they are not telling the truth. They are not telling you complete presentation. Okay. So in the exam, it will be like that because they want to test your skills. You will ask about everything or not. Okay.
I need
So
to ask from this point at the presenting illness, not in the systemic review. I
here,
need to exclude here
here,
at this point.
yeah, here regarding trauma, once you finish Odibara, you will go for genitourinary, and after that GIT, after that skin changes musculoskeletal, sorry, and the miscellaneous. You can go for musculoskeletal after that. Okay. So once you will ask the patient, do you have any trauma? He will say yes. I felt blah 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 blah. If you are go step by step, believe me, you will not forget anything. You will catch the station.
Okay, thank you, sir.
Welcome. Okay, Dr. Ahmed Al Amin.
Okay, Dr. Hani.
You can start.
Okay, I'm going to wash my hand, put on my PPE. Hello, I'm Dr. Ahmed Al Amin, ED registrar. May I confirm your name and age, please?
Yeah, I am Karim, 43 years.
Nice to meet you, Mr. Karim. Today I've been asked to take some data from you. Would that be okay?
Yeah.
Before we start, are you having any pain or discomfort right now?
That's okay.
Okay, so how can I help you today, Mr. Karim?
Yeah, I have bleeding per rectum.
Oh, I'm so sorry for that. Let me shift you to a private area in the resuscitation room, check your vital signs, and put you on monitor. So I will have also a nurse attending with us. Would that be okay?
Okay.
So, Mr. Karim, can you tell me more about this rectal bleeding?
Yeah, this one happened like 1 week ago. It's increasing and worsening, and it's painful.
I'm so sorry for that. Did it start suddenly or gradually?
Gradually.
And since 1 week, you still have it till now, correct?
Yeah.
Okay, how many times do you have this rectal bleeding per day?
Like 5 times per day.
How much is the amount every time? Like it is like spoons? How many spoons or how many cups?
It's like a teaspoon each time.
I see. What is the color of the blood? Is it dark red? Is it black?
Fresh.
Is it fresh blood?
Fresh.
Okay, do you have any bleeding from any other places?
No.
Okay, so Mr. Karim, since the beginning, is it getting worse, improving, or is it the same?
Worsening.
Is it on and off or continuous?
Each time to pass stool, I have bleeding.
I see. I'm so sorry for that. Is the bleeding before the stool, during, or after the stool?
After.
I see. So anything you think can make it better or anything make it worse?
No idea.
Okay, so Mr. Karim, are you having any tummy pain?
No.
Did you have any anal pain?
Yeah.
I see. Are you having any sense of nausea or did you throw up?
No.
Okay, any change in your bowel habits?
No.
Any yellow discoloration of your eyes?
No.
Any urinary troubles like painful urination or change in the color of urine?
No.
Have you lost weight or appetite abnormally recently?
No.
Do you have any masses in your body?
No, no.
Do you have any night sweating or fever?
No.
Any skin changes, skin rashes?
No.
Do you have any shortness of breath or cough?
No.
Any chest pain or heart racing?
No.
Any headache, blurred vision, or loss of consciousness?
No, no.
Any recent injury, any paralysis, numbness, or weakness?
No.
Mr. Karim, do you have any previous medical problems?
No.
Any surgeries done before or hospital admissions?
No.
Any disease run in your family?
No.
Are you taking any prescribed medications or you have any allergies?
No.
Have you traveled recently?
No.
Mr. Karim, are you sexually active?
No.
Mr. Karim, do you smoke or drink alcohol?
No, no.
By any chance, sorry for the question, do you take any illicit drugs?
No.
Where do you live, sir, and with whom?
My wife in downtown.
I see. Mr. Karim, is there anything you wish to add for me regarding your health?
No.
Is there any specific concern that you have?
Yeah, I am worried. Is it cancer, doctor?
Oh, I see. Actually, your concern is appreciated, Mr. Karim. However, I don't think you're having cancer. You're having this bleeding with pain in the rectal area, and most probably this is a local problem. Usually, it is caused by dilated veins in the area, which we call it hemorrhoids, or sometimes it could be like an injury, we call it a fissure. So for confirmation of diagnosis, I'm going to keep you in the observation room, do a full examination for you. This will involve examining your tummy and also examining your rectum. Also, I would like to consult the surgeon to have a check on you. And if the bleeding is not confirmed, we might need also a gastroenterologist for camera scanning. And meanwhile, I will also order for you some blood tests, including blood hematology biochemistry, as well as blood grouping, blood safe cross-matching. And if we need, we might need to give you a blood transfusion if your hemoglobin is too low. Okay, that this seems reasonable for you, the management plan, Mr. Karim.
Yeah, yeah.
Do you have any immediate questions for me?
No, thank you.
Thank you very much. Take off my PPE, wash my hands.
Okay. What do you think, guys?
Over 10, 11 over 10, and not less than that.
Medication.
Perfect.
Okay. Amazing, Dr. Ahmed.
Thank you, Dr. Ahmed.
Well done, mashallah. Allah bless you. Okay, so we finished today, guys. Again, guys, please, 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 if someone did not join the channel, whatever the not concise channel or the concise channel, please join, because we will post all PDF. It will help you to pass easily the exam. And please, please don't share any material from the course, please. Okay, so don't waste our effort. Do you agree, guys?
100%.
Yes.
Yes. Offer it, appreciate it.
So I will do my best for you, and also you have to not share anything from the course. Okay, anyone has any question before we start?
Yes, Doctor. Yes, Doctor.
Yeah.
Dr. Hani, regarding this, I go through the checklist that you are posted previously.
Yeah.
And I believe they give point for anyone you are put here. There is like point. You should ask about this. You should ask about this, because what they call it, this is checklist.
Yeah.
I'm just speak generally for me and for my colleague also. I observe that they are focusing 3 points in the history, especially the consent, verbal consent you will take, and the invitation question and the open question. This is just general and gentle reminder for all of us.
Yeah, yeah, sure. Excellent.
Yes.
Yeah, some times the people, they are not asking about the content. It's very, very important. Even yeah, even it's a history. Don't think it's a history. No need for consent. No. If you will talk to the patient, you have to take permission from him. I need to take some data from you. This is very, very important. Okay, yes. Before we start. And also the management plan. Don't give him all differential diagnosis and management plan as a bulk. No, you have to give him piece by piece.
Yes.
According to your data, the most likely problem, blah, 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 blah. But we need to roll out other problems. Is that clear for you? So always check understanding. Always confirm he understood. Okay. Excellent, Dr. Sam.
Thank you.
Hello.
Yes,
Yeah.
Dr. Hani.
Can I ask,
yeah.
sir, in last exam in November, regarding sexual history, female patient, at last she was showing one report with a pregnancy test negative and proteinuria plus.
Yeah, you have to do serum. You should confirm this pregnancy test urine. If urine, you have to do serum pregnancy test.
Okay.
Yes, but during pregnancy test was negative, so we will do still a serum pregnancy test, Dr. Hani. Is it right?
Yeah.
Yes.
Serum beta
And
HCl.
regarding yes, and regarding her sexual same station in November exam, she had sexual intercourse before 2 weeks, so it is out of the window period for post-exposure prophylaxis.
Yeah.
Is it right?
Yeah.
Yes. So we will do HIV and STI investigation, and if HIV is positive, we will refer her to GUM clinic, or should we start post-exposure prophylaxis?
You have to, if the HIV is positive, you have to start active treatment for HIV, not post-exposure.
Active
Okay.
treatment for HIV.
HIV.
If HIV is positive, okay.
Yeah.
So post-exposure is different than HIV.
It means you will give her antiviral.
Yeah, antiviral.
There is difference between antiviral and the post-exposure prophylaxis. Post-exposure prophylaxis, it means the patient is at high risk, this is number one, and within 72 hours, this is number two,
yes.
and
Yes.
the patient not yet known to be HIV.
Okay, exactly, yes.
Clear?
Yes, now it's clear, yes. So
Yeah.
in that case, if low risk, I mean more than 72 hours, so the concern will be
No,
urine
low risk it doesn't mean more than 72 hours. Low risk, it means according to the history, according your questions, and according to the answer of the patient, he is denying. For example, how many partner? He said one partner. This patient was protected or not? Yes, protected. So it's a low risk. Different than the window, 72 hours. Okay?
Okay. Yes. This is main confusion I had. Anyway,
Yeah.
so inshallah we'll be careful. Yes.
Okay.
And regarding proteinuria plus, is it relevant to the stations?
If protein is high, you have to check the patient is pregnant or not. Okay, so you have to rule out the serum pregnancy test, and you have to rule out other problems. Always be diplomatic, guys. Okay, so they are not testing your knowledge how to deal with the situation. Okay.
Okay.
Yeah.
Thank you.
Welcome. Okay, guys, inshallah, tomorrow for the next part. The next part will be what, guys?
Who approach pediatric?
Pediatric, okay. Thank you.
Dr. Hani, one question, I'm sorry.
Yeah.
If we don't reach diagnosis, we will lose in the session, I mean in the station.
If you will not reach a diagnosis, maybe he will give you 6 marks.
Okay.
So you have to ask the most relevant questions. You have to be logic. You have to be confident, calm. Don't be in a hurry. Don't be slow. And you have to reach thank you. I want you to say the patient thank you in the end. It means you finished everything, right?
Yeah, thank you, Dr. Hani.
Welcome. Okay. Bye, guys.
Bye. Thank you so much.